And if I'm worried during this presentation, I'll just put my hand in my pocket. You won't know I'm squeezing the rock. Water helps a lot. So today we're continuing on with the mental health miracles. So I think we're going to start with a prayer. And I think everyone has just about arrived, probably. Oh, and that reminds me. Just during the presentation, if everyone could turn off their telephone, including myself, that would be helpful. I know, I'm so demanding. Okay, let's start with a prayer. Dear Lord, we're just so thankful to be here on this beautiful day. We just pray and ask, Lord, that you'll be with us during this time. I pray that you'll speak for me and that this information will have the impact that you want it to have. In Jesus' name we pray. Amen. I know Andrew's not here right now. Did he? Oh, interesting. Okay. Yesterday we started talking about resilience, and we actually, before I start, this reminds me, just a little bit of housekeeping. Tomorrow we're having the free in-body assessments here at the church. The first appointment's at 10 o'clock. The last appointment's at 3:30, ending at 4 p.m. So as I mentioned yesterday, the in-body machine is a machine that does a complete body analysis of your percentage of body fat, how much you weigh, skeletal muscle mass, the distribution of muscle through your arms, your legs, etc., resting metabolic rate, or also known as your BMR, basal metabolic rate. And then the computer comes up with the final analysis of whether you have to lose fat, gain muscle, etc. So during our appointments, and when you're coming, please come wearing very light clothing so that your body weight is pretty accurate. Better to come after. If you're eating, don't eat and then come right away and jump on the scale, because that's not going to be accurate. If you're coming in the morning, better to come before you eat and then go home and eat after. And you're also going to have to take off your shoes and socks. So, well, I'm going to be disinfecting the machine after every person comes on, but please wear shoe wear that is easy to take off and put on. So the first appointment's at 10, last appointment's at 3:30, and Thyra is the one to see to book the appointment times. I think she already has a schedule going, so you can go to see Thyra to book your appointment times tomorrow with the in-body assessments here at the BLC, starting at 10 o'clock and final appointment at 3:30. I'll also have a printout of what the results were, and you can take the printout home with you. On Thursday, also here at BLC, I'll be available to see any patient who would like to book a naturopathic appointment. For that, you come see me after the talk. And also on Friday, anytime between 10:30 and 4. Does anyone have any questions about that? No. All right, let's get into it. Resilience. Yes, please, Glenn. So if it's an initial appointment, meaning that I haven't seen you as a patient before, it's an hour and a half. If it's a follow-up appointment, meaning that we had an appointment last time, it's 45 minutes. And if it's the initial appointment and you have any lab work that you've had done, even in the last 2 years, it would be really helpful if you bring that lab work with you, and then we'll go through your labs together. And that also helps me with the assessment of current health situations. Great. Resilience habits, the mental health miracles. So yesterday we talked about mental health. We also talked about resilience. And I went through some of the basic mental health diagnoses. I touched on resilience a little bit, just as a tool that could be used to help with better mental health and improving mental health. So today I want to talk about how to become more resilient and some studies on resilience as a step towards improving our mental health. So that's going to be the focus. And of course, we've got that man there trying to pole vault to the other side. Just showing, like, kind of depicting the picture of how do we progress and move from where we are to where we would like to be in terms of our own happiness and mental health. And how do we get across that chasm? And hopefully, some of the information during this week will help to jump that gap. Boom. Okay. I want to congratulate everyone for coming tonight. Congratulations on whatever changes you're making. Maybe you went home yesterday and you thought about what we talked about. Oop, you're on the right road. Maybe you went home and you thought about the things that we talked about, and perhaps you made some decisions, like I'm going to exercise more. I liked what we talked about the breathing technique. I'm going to try that. I'm going to change my posture when I'm in a stressed situation. Or maybe you just reviewed the notes. Maybe you rewatched the video. I think it's on the BLC YouTube. Or maybe you didn't, but maybe you just decided that you're coming. So hopefully tonight's information is going to be helpful, but congratulations on being here and on whatever decisions you're making about improving your health. One of the things I focused on yesterday was addressing stress. And we talked about what stress was, the fight or flight response, the different chemicals that are released during stress, and how it works with the amygdala kind of taking over, and then the hypothalamus then secreting a hormone which affects the anterior pituitary gland, which then secretes a hormone which affects the adrenal glands, and then the adrenal glands releasing cortisol and releasing adrenaline. And then we feel kind of, a little more hyper, a little more alert. And I asked people different ways that they address stress. And we want to get to the point with stress where we're not just managing stress. We are hopefully eliminating stress. One of the things I said was stress is really based on your perception of an event and not necessarily the event itself. I mean, there are some events which across the board, nearly everyone would have a fight or flight response, maybe not. But sometimes we're bringing our own experience to what's happening currently, and that experience causes us to have a fight or flight response when someone else wouldn't. Sometimes it's a new experience. Sometimes we've been trained. If this happens, this happens, this happens, that's stressful. You're supposed to be stressed out. If these things happen, they're calm. You're supposed to be relaxed. And I just encourage people, if that's the case, maybe including myself, to change your point of view. You don't always have to respond to certain things with the stress response, or with anger, or with irritation, etc. It's possible to respond differently. So the stress response is in many ways within our own control. Let's say, within our own minds. Actually, I mentioned Viktor Frankl yesterday, and I hope I get this quote right, but I have one of his quotes by my bedside so that I remember every night. And it's ironic because I can't remember it exactly right now because it's not by my bedside here with me. But basically, he says, between stimulus and response, there is a space. So between the stimulus, whatever that stressor you want to call it is, and your response to that stressor, there's a space. And in that space lies your own control and adaptation or response to the stimulus. So between stimulus and response, there's the space of your own objectivity. And in that objectivity, you have the opportunity to actually respond differently. Does that make sense? So addressing stress, resilience, what is it, and can we reprogram ourselves? And we definitely can reprogram ourselves. If we were programmed in the first place, as many of us were, maybe as children, and when we're younger, the brain tends to be a little more plastic, a little more malleable. But what they're finding in recent studies, even as recent as 2010, and a great book was written at that point, maybe 2010, 2011, somewhere between 2009 and 2011 by a Canadian psychologist slash psychotherapist, and it was called The Brain That Changes Itself. And then he wrote a follow-up book, The Brain That Heals Itself. And it was just an interesting research project into neuroplasticity, just showing that your brain is plastic, meaning your brain can change as you get older. One of the things that makes a difference is a chemical called acetylcholine, and acetylcholine is released when we're focusing. So maybe as children, we just absorb things. We're like sponges. You don't have to try. The saying you can't teach an old dog new tricks is actually incorrect. Anybody can learn at any age. Just when you get older, you need a little more focus. So a little more intention and a little more focus. And with a little more intention, a little more focus, we can reprogram ourselves, if we want to use that wording. We can kind of rewire our brain. A little more focus, a little more intention, and a little more consistency. So the question with resilience, can we reprogram ourselves? And this is from Harvard Health, and the article was called Ramp Up Your Resilience. And the article says, coping with stress in a positive way is known as resilience. It has many health benefits. It's associated with longevity. So basically, if you are able to cope better with stress, then the tendency is that you might live longer. It doesn't mean that a truck won't go out of control and you'll be hit while walking on the sidewalk, but you'll be healthy when you go down. But it helps with longevity and health span. It helps to lower rates of depression and greater satisfaction with life. And this is from Harvard Health. And the article said, and I quote, "There's a sense of control, and it helps people feel more positive in general." So we are going to talk about the Emmy Warner study that I actually referred to yesterday, but it was this sense of control with the kids that really helped them to become more resilient and thrive as they were older, despite the difficult circumstances they had had in childhood. And I think in the example that we talked about with the with Auschwitz and the camps, etc., at least for Viktor Frankl, it was this sense of control in how he was interpreting what was occurring, despite what was occurring physically outside of his own mind, if that makes sense. So resilience is this sense of control that helps people feel more positive in general, and it helps us to deal with stress. It's dealing or coping with stress in a positive way. That's known as resilience. And the question was, can we become resilient at any age? And the answer is yes. It's just learning. And I started with the idea you can't teach a dog old tricks. No, an old dog new tricks. Just to just to kind of create that base idea that we can learn at any age. The old dog can learn new tricks. It might take just a little bit longer, a little more consistency, and a little bit of focus. Okay. So, oh no, you need the rock. You need the worry rock. Resilience. Can we reprogram ourselves? Likewise, a lack of resilience means that you may not handle stress well in difficult situations. And it's those difficult situations where it's more likely that fight or flight response might happen just like that. So it's a matter of practice. That difficult situation, remembering between this difficult situation and my response, there's a space. I can choose how I'm responding before I get emotional or feel fearful. Once that happens, the amygdala takes over, and it's the beginning of that stress cascade, and lots of stress chemicals and hormones being secreted. But if you can just take a few moments, even in that difficult situation, to practice the breathing we talked about yesterday, inhaling through your nose, a long breath out of your mouth, that might give you an opportunity to make some decisions based on an unstressed brain and see the situation differently. And so this is from the article in Harvard Health. Chronic stress is associated with harmful health consequences, such as high blood pressure, a weakened immune system, anxiety, depression, insomnia. And we mentioned all of those yesterday when we were talking about mental health, anxiety, depression, insomnia, heartburn, indigestion, heart disease, etc., all affected by stress. And if you look at it the other way, is it possible, if you're not stressed or become more resilient, that some of these conditions might actually ameliorate? And we're hoping so. If you're wondering what that picture is, those are neurons in the brain. And the more consistent you are in your new thinking, then eventually those neurons, one of the basic rules of neuroscience is neurons that fire together, wire together. Neurons that fire apart, wire apart. So the more you think consistently in one manner, the more those neurons fire together and they kind of create a new pattern of thinking. If you're thinking one way and you want to think a different way, you have to begin disrupting your normal thought pattern. Oh, I used to think that, but now I think this. And some of it might be self-talk. Some of it might be the breathing. Some of it might just be like, normally I would stay here and argue, but you know what? Instead, now I'm going to go and take a time out, step outside, look at the trees, practice gratitude, and then I come back and continue the conversation. Disrupting the pattern is the beginning of rewiring, hopefully that makes sense. So that's what that picture was. The interesting thing about stress, and this person has kind of that posture that we had yesterday. So yesterday I asked everybody to put their hand on their head, so it's the prefrontal cortex here, and to look down and to stay in that position, hunching your shoulders forward. And after a certain period of time, I didn't ask you to hold it for long enough, but if you stayed in that position, eventually your mind would bring all of those things that you're worrying about to mind. And before you know it, you're really stressed out based on your posture. You don't want to do that. Instead, you want to do this. And then you feel better. I feel better already. But when you do that, those bliss hormones are secreted when you hold that posture for long enough. Endorphins, some dopamine, some serotonin, the bliss or happiness hormones. Now, the interesting thing about stress, and I'm sure we've all experienced it, is when you start thinking those stressful thoughts, it seems as though they begin compounding. And maybe then you remember something from the past that was similar and that was stressful. And stress tends to multiply itself, you could say. It gets bigger and bigger and bigger and bigger. So the longer you stay in a stressful state, the more stressed you feel. Does that make sense? So you start off like this, and then it gets bigger and bigger and bigger, and then you feel like, I'm overwhelmed, I can't cope, this is too much for me, etc. So one of the first steps is to stop that unraveling, you could say, before it really begins to spin. Some people say I'm spiraling. So you want to stop it quickly with some of the things we talked about yesterday, but I do have a summary slide for some tools for stress reduction. So these are things you can implement as soon as you feel that happening. And I've felt that happening before where I'm like, I'm just too overwhelmed. And for me as a Christian, that's the trigger where I feel like that and I just pray right away. And I do breathing and prayer at the same time. It's just an implementation that I've been practicing. I will pray and breathe, and then I'll go back to whatever it was that I found stressful. And it's amazing. It's like that fight or flight response just comes right down. And it's like, okay, let's keep going. So you want to address that feeling of stress before it just is magnified. Some of the feelings associated with stress are you're envisioning maybe the worst thing. These things all create electrical waves of energy in the brain, not in a good way. Envisioning the terrible thing that's going to happen, the worst possible response or outcome. Then you remember when things didn't go well the last time. Then you think of next week. Oh my gosh, I have to do this, this, this. And then you try to plan, but you're overwhelmed. You're feeling stressed, anxious, worried. And of course, there's a fear and frustration factor as well. Just saying all those things made me feel stressful, stressed out. Planning is good, but over planning. Yes, I will put an OVER before the planning. But sometimes it's analyzing, ruminating, and sometimes it's planning to fail. Yes. Yeah, exactly. So we want to plan to succeed. So our brain is a chemical factory. The wonderful thing about the brain is it's like a natural pharmacy, where we can create good chemicals or positive chemicals that make us feel good, or chemicals that make us feel stressed out. We want to put our brain in a parasympathetic state. Parasympathetic means that we feel calm, we feel relaxed. There's a quick onset. As soon as you start doing the breathing, you feel calmer, relaxed, thinking positive things. Lavender can be very helpful as well, as I mentioned yesterday, though I did bring lilacs, but lavender, very helpful for de-stressing the mind. And then just before bed, a few things that you can do. Changing your lights from lots of lights to lower lights. We're going to talk about sleep a little bit today. And then maybe at the end of the day, reading, journaling about some positive things that happened, things you're grateful for, etc. Did anybody do their homework? Did anybody write about things they were grateful for yesterday? Not one person. Did anybody, you thought about it, okay. Did anybody write about a positive experience? Oh, I heard some thought about it and one person did. And then the other thing was to send out a thank you to someone, a text saying thank you. You said it out loud personally. Awesome. Okay, great. So those things have been found to kind of shift anxiety, worry, depression, etc. One of the things that helps with better sleep is a nice pre-bedtime routine, which we're going to talk about today. Better sleep leads to more resilience. And we've got a little friend flying around here, but hopefully nobody's stressed out. You're stressed out? Really? Oh. Maybe we need a wasp catcher. If there's anybody who's a wasp whisperer, any professional wasp whisperers in the house? Oh, yeah, a towel's good. That might be the end of his reign. Continuing on, and hopefully people aren't stressed by that large flying wasp-like thing. How to eradicate stress. Exercise, very effective for reducing stress, and reducing stress increases resilience, and that's what we're focusing on, how to increase resilience. So on this slide, there's a nice summary of different ways to decrease stress. I'm just laughing because it's trying to exit. It's at the exit. Sure, we can open the door, and will the alarm go off? That would be a little bit stressful. No alarm. Okay. Okay. Maybe we could encourage it to just, fly. All right, different ways to eradicate stress. It's going into probably where it lives, above our heads in the ceiling. How to eradicate stress. I like your shirt. Jesus loves you. Awesome. Different ways to eradicate stress. As I said, sometimes when I feel stressed, I pray. There was a book written by Dr. Andrew Newberg, and it's called How God Changes the Brain. Dr. Newberg is actually not a Christian. I believe he's Jewish. But in some of the studies that he writes about in the book, they were watching the way that the brain changes during prayer using a functional MRI. So they could see in the functional MRI when people are praying that their brain's actually changing, kind of de-stressing. So just showing the wonderful de-stressing effects of prayer. Exercise, very effective for eradicating stress, even something as easy and simple as walking. Going out walking somewhere that you don't find stressful. I was talking about walking for de-stressing, and someone said, well, walking in the woods, I'm afraid of the bears and the animals, and that would be stressful. So somewhere nice and calm. Relaxation, saunas, journaling. So this idea is that you're writing down, this journaling in particular, you're writing down things that you find stressful. So you're getting it out of your mind, kind of, you could say, off your chest and onto the page. And then after that, the important thing is you don't reread it and then get all stressed about it again. So you put it on the page, and after that, you can tear it up, you could write a prayer, you can put it in the garbage, but it's out. Breathing, as we said, you want your exhalation to be longer than your inhalation. Confiding, meaning finding somebody that you feel you can trust. This could even be a counselor or a therapist. And sometimes there are things that people have never, ever said. I'd had a patient who, during a visit, told me a few things and then said he's never, ever said that to anyone in his life in 48 years. I was like, wow. So just sometimes sharing something can really change things and be very distressing. So confiding. With confiding, we don't want to over-confide. So over-confiding has two meanings. One means that you feel vulnerable now. Maybe you've confided in the wrong person, and that's stressful. And the other thing is retelling the story again and again and again. Because every time you retell the story, to a certain degree, it's like you're re-experiencing the story, and then you get angry all over again, or frustrated or fearful, and then you're just encouraging those chemicals of stress all over again. So confiding, but not over confiding, and not retelling to the point where you're re-stressing yourself. Certain types of music, I said, can be very helpful for eradicating stress. Music that's harmonious, where there's a good melody. Music where there's a lot of dissonance does the exact opposite thing and activates the stress response and makes you feel very, even hyper. But we want the nice, calm music. And I had mentioned the band or the group Marconi Union and the song Weightless. Did anybody look it up last night? Nobody did their homework yesterday. Was it stressful? Oh, you weren't here. Weightless. Weightless. Weightless as in you have no weight. You're very light. Marconi Union. What's that? Useless? No. Useful. So Marconi Union, Weightless, yes. Oh. Is that stressful? Yes. Right. Doing all these other things. So the idea is of homework is not that, now I have to do this as well, and that's stressful. But hopefully, whatever homework I'm recommending is not a stressor. It's hopefully a pleasure. But you do it at your leisure. I'll only ask today, and I won't ask every night. Did you do your homework? And of course, laughter and smiling. So they've done studies on laughter. As a matter of fact, at one point I ran a laughter club at school, just because studies are just show so clearly that laughter can help to eradicate stress, can help to boost the immune system. So in one study, they'd taken blood tests of kids who were in the hospital, and then the kids went to watch a show with like a funny show, and they were laughing, and then they checked their blood tests again, and their white blood cell count had gone up just by laughing during the show. So laughter to help boost immunity, to help secrete those bliss hormones, dopamine, serotonin, endorphins. So smiling and laughter. It's very hard to feel angry and smile at the same time. Yes. I know, I have. Yeah. He had ankylosing spondylitis, actually. Mm-hmm. Yeah. Yeah. Yes.
Was a major part of his healing.
Yeah, and I think he wrote like a novella about it. He wrote about it. I don't know if
Anatomy of an Illness. He wrote a few books.
Yeah. So, in case that wasn't, everybody didn't hear that, it was the story of Norman Cousins, who basically laughed himself back to health after being diagnosed. I think it was ankylosing spondylitis, and I remember hearing about him. That inspired me to start the Laughing Club, actually, at school. He watched a lot of movies, and he just laughed and laughed and laughed. He did a few other things as well, and naturally healed. And one of the primary, let's say, tools was just laughter. And then he wrote a book called, what did you say? Anatomy of an Illness. Yeah.
But he wrote more than one on that topic, really.
Mm-hmm. So that's the effect of laughter. So they found with those kids that just in watching a show, their white blood cell count went up.
Within an hour.
Very short period of time.
Really quickly.
Yeah. So if you laugh in the next 3 hours, just laughing through this whole presentation, that might irritate me, but you will feel better. So yeah, unless I'm stressed. So
I'm here all night.
exactly, between that stimulus and me, there will be a space. So Shinrin Yoku is something that I mentioned yesterday, walking in a forest, very effective for stress reduction as well. And so I just want to ask you, I'd asked yesterday, but we have a few more people here. What do you do when you're stressed? Somebody said gardening. And the only thing I wanted to mention about gardening, like putting your hands in the earth, etc., is sometimes people can get stressed about their garden. Like I have to do the gardening, I have to water the lawn, etc., and then it works the opposite way. So more like gardening slowly and appreciating the beauty of the garden. But what do you do to decrease your stress? Anyone? Sleep in. Okay. Definitely there's an association between sleep and stress.
Work.
Lack of sleep. Work. Do you enjoy your work?
I wouldn't work otherwise.
Okay. So work for some people is a stressor, but then work for other people who enjoy their work, it's a relief or it brings a sense of relaxation. Anybody else?
Walk.
Go walking. Excellent. Anyone else?
Listen to music.
Right. What kind of music?
Well, I won't tell you heavy metal or anything like that, but I don't listen to that anymore anyways. But,
Yes.
Well, I like actually music from various countries. Like the countries of the Caribbean have a lot of very good music.
Joyful sounds.
And also African music.
Yep.
I like that.
Listening to music.
I also like early rock and roll.
Sure. Maybe a little bit of
I'm right beside
movement
me. I'm
as well.
Speaking loud enough into it.
so listening to music. So someone said walking, and walking is a type of exercise. So today I want to provide you with different tools and techniques that would be effective. So exercise for greater resilience. But first I want to prove that it's effective. Yes, go ahead.
A smart man once said, if you get a job that you enjoy, you'll never work another day in your life.
If you get a job that you enjoy or love, you never work another day in your life. I heard that when I was quite a bit younger, and I thought, oh, that's my goal, to love my job, and then you'll just, love life, and it'll be awesome. And then I realized that
the singer
not
Bob
very
Dylan-
many
sorry.
people love their job, and work isn't always fun.
The
Yes.
singer Bob Dylan has said he has not worked a day in his life.
Because he loves what he does. And that's de-stressing for sure. So this was a study that was done at Princeton University. And the bottom line was exercise reorganizes the brain to be more resilient to stress. And it was a study that was done on mice. And they wanted to see the effect of exercise and stress and resilience. Not that I really condone mouse studies, but it's often used in studies to prove what can be possible for humans. Go ahead, Henry.
If I do a puzzle, it reorganizes my brain as well.
Doing a
A
puzzle.
few puzzles.
Yep.
Yeah.
And actually, that's one of the reasons why puzzles are often encouraged for when people are getting older. Puzzles, reading, a language, or music all have a really strong effect on your brain. Yes, go ahead.
I'm getting slower, though.
You're what?
Getting slower, though.
You're getting slower at the puzzles. At least you're still doing them. So in this study, this was the overall idea. Physical activity reorganizes the brain, so that's response to stress is reduced. Anxiety is less likely to interfere with normal brain functions, according to a research team that was based at Princeton University. And I can see that this needs to be kind of centered into the middle of the slide. This is what the researchers reported in the Journal of Neuroscience, that when mice allowed to exercise regularly experienced a stressor. The stressor was exposure to cold water, and I'll tell you a little more about what they did. Their brains exhibited the activity of neurons that shut off excitement in the ventral hippocampus, and that particular chemical that was secreted is a chemical that's shown to regulate anxiety, and is called GABA. And I think I have some more information about exactly what happened here. What they basically said was understanding how the brain regulates anxious behavior gives us potential clues about helping people with anxiety disorders. It also tells us something about how the brain modifies itself to respond optimally to its own environment. This is a professor at the Princeton Neuroscience Institute. Again, I wanted to put the little mice in there. So this is what they did in this experiment. For the experiment, one group of mice was given unlimited access to a running wheel, and the second group had no running wheel. So there was a cage with a running wheel, and as you probably know, rodents are nocturnal animals, so every night they're there running away on the running wheel. With the other mice in the cage, they had no options like that for exercise. No running wheels. Everything else was the same. Natural runners, mice dash up to 4 kilometers, about 2.5 miles per night, if they're given access to a running wheel. After 6 weeks, the mice were then suddenly exposed, and I read this whole study, unfortunately, suddenly exposed to cold water for a brief period of time. So something they're not expecting, a sudden acute stressor. The brains of the active and sedentary mice actually behave very differently almost as soon as that stressor, the cold water, occurred. An analysis showed in the neurons of the sedentary mice only, the water spurred an increase of immediate early genes or short-lived genes, which rapidly turned on when these are rapidly turned on when a neuron fires. The brain in the running mice showed every sign of controlling its reaction to an extent not observed in the brain of the sedentary mice. So they're both exposed to the same stressor, but their brains responded differently. There was a boost of activity in the inhibitory neurons that are known to keep excitable neurons in check. So basically, these neurons are keeping the fight or flight response in check. At the same time, neurons in these mice released more of the neurotransmitter called gamma aminobutyric acid, or GABA. Some people might have heard of GABA because it's also a supplement that you can buy in the health food store, and people take it when they have anxiety or to help them sleep. So the mice were naturally creating this chemical that makes you feel calm and relaxed, which ramps down neural excitement. Even though they're in the water, their brain's secreting a chemical that's helping them to remain relaxed in a stressful situation. That's incredible, right? The sedentary mice were not having the same kind of response. Instead, they're having an excitatory response. So the only difference there with the mice was exercise. And so they did this study because they wanted to know, could something like this also be happening in humans? If you exercise regularly and then there's a sudden stressor, would your brain secrete GABA and help you to stay calm in the midst of the stress versus someone who doesn't exercise regularly and is more sedentary, and then their brain might not respond the same way? So this is just proof that exercise can be a key factor in resilience and managing stress. Is everyone excited about that? You feel like going and exercising? Not right now, maybe tomorrow. More studies, but this was actually on humans, so I started with mice. This is from the International Journal of Clinical and Health Psychology, and from this was actually in that journal in 2022. The name of the article was "The Roles of Exercise Tolerance and Resilience and the Effect of Physical Activity on the Emotional States Among College Students." Why pick college students? Because for most college students, they're already in an atmosphere of high stress, just going to school, as well as possible relationships, friends, etc., being away from home. But even just the stress of homework every night and trying to get good grades, it can be pretty stressful. Exams, etc. So I think that's why they pick college students for this particular study. Accumulating evidence indicates that regular physical activity, and in this study for physical activity it was PA, can positively influence negative emotional states. And I think that's all we need to know, which is what we said yesterday. Exercise can change a negative state to a positive state. Among possible candidates, resilience and exercise tolerance in particular have the potential to partly explain the positive effects of physical activity on negative emotional states. So as you're exercising, over time you're building up your resilience and your response to stress. That's kind of the ongoing message throughout these studies. When we're looking at a study, the longer the study and the more people involved, then the greater the credibility of the study. So if we did a study of 5 people for about 5 minutes, doesn't really prove anything. But if we did a study of 1,000 people for 5 years, then it would hold more weight. So in this study, there were 1,117 Chinese college students, 50.4% female, so almost 50-50. The median age was 18.9 years old, so a little bit older than 18, a little bit younger than 18. And they completed a psychosocial battery, a bunch of tests to kind of see what their baseline was at the beginning and then at the end. And I see the food's coming out, which is awesome. So I think after I talk about this study, we'll take a break to pray for the food. So some of the scales or the tests they did were depression and anxiety stress scales, the Connor-Davidson resilience scale, the preference for and tolerance of intensity of exercise questionnaire. So when I say scale, I'm referring to a type of questionnaire or survey, and the International Physical Activity Questionnaire short form. The only thing about questionnaires is questionnaires are based on someone actually filling them in accurately. So hopefully when people fill in questionnaires based on a study, they're being 100% honest and their recall is accurate. That's the only questionable thing about questionnaires. So basically they were given all these questionnaires at the beginning of the study. The results. The results showed that physical activity, exercise intensity tolerance, meaning you're building up your exercise and your ability to exercise, and resilience were significantly negatively correlated with negative emotional states. There were a lot of negatives in there, and 2 negatives equals a positive. So basically, the more they exercised and build up their exercise abilities, then the fewer negative emotional states they had. Further exercise tolerance and resilience partially mediated the relationship between physical activity and negative emotional states. Basically, resilience is going up. One of the, whoops, did I skip something there? Okay. Okay, I think I said that. Yes. No stress. Yes. Oh, yeah. Okay, I was right. One of the most frequently studied protective factors against stress, anxiety, and depression, and this is the overall final statement, is basically physical activity. And it's studied in mice, it's studied in humans, it's studied in college students. So a protective factor against stress, anxiety, depression. So it can be helpful if you are experiencing stress, anxiety, and depression. But as we saw with those mice, it's also protective. So exercising now so that when you're in a stressful situation, your brain will respond differently, you'll respond differently, or even thinking of it as a way to thwart off anxiety or depression. From a molecular perspective, BDNF, which is brain-derived neurotrophic factor, which is one of the most neurotrophic factors in the brain, is associated with an increased physical activity level. So basically, your brain secretes BDNF when you're exercising, which is very protective. So as we exercise, and as far as I know, this is more like cardiovascular exercise, like repeated movements. And so that could possibly be one of the reasons why it's so effective for resilience and stress. There's evidence to suggest that decreased BDNF, especially in the hippocampus, is related or correlated with stress-induced depression and anxiety levels. So there's a correlation between low BDNF and depression and anxiety. Therefore, if you have higher BDNF, it's possible that it could be more protective in terms of experiencing depression and anxiety. Does that make sense? The bottom line is exercise is good for us, but it's also very, very good for our mental health. In summary, resilience and exercise intensity tolerance can be achieved through regularly engaging in, the word missing there is physical activity. The key word there is regularly. So if you want that benefit, then exercising once probably won't do it regularly. In the test or the study with the mice, they were regularly running every night, 2.5 kilometers, I think, or miles per night. So regular physical exercise puts you in the type of state where you respond to stress better, and also it can help to maybe avoid or help with more intense feelings of anxiety and depression. With respect to psychological factors, researchers have recently paid great attention to resilience and have proposed that physical exercise reduces negative emotions through improved resilience. I just feel like going out and walking right now. Physical activity, the bottom line, helps build resilience. Whatever that physical activity is, you might want to dance like this fellow, or you might want to run like these mice. Exercise in the mouse studies, as I just showed, caused the release of GABA from the brain when the mice were put in stressful situations, allowing the mice to blunt the fight or flight response and to become more resilient. Or you might just want to walk. So brisk walking is your best exercise. This person is not brisk walking, he's strolling. But the person behind him, he is maybe strutting. Exactly, that person is brisk walking. According to the Canadian Heart and Stroke Foundation, they recommend 150 minutes of brisk walking per week. 150 minutes per week. So that might be Monday to Friday, 30 minutes per day. And that's for helping to have a stronger heart and to avoid certain heart conditions, as well as stroke, MI, etc. 150 minutes per week. 150 minutes of brisk walking per week. So this is continuous walking. You might go for a 30-minute walk, maybe Monday to Friday. I see the food coming out. So before we talk about sleep, though after people eat, sometimes they want to sleep. So this might not be well timed. But I'm going to wait until everyone has their food, and then we'll say a prayer over the food. But this gives us a nice little opportunity, maybe for a bit of an intermission for questions. Does anyone have any questions so far or comments?
Yeah. What
Yes.
was the other part of that where it's the little wheel of stressors? I didn't catch the top, middle, and left.
The brain shot? Was it this one?
Yeah, that. Thank you. That's
We'll talk more about it. We talked about some of these things yesterday for stress relief. The breathing, I actually don't know if we're going to talk more about the breathing. So yesterday, in terms of breathing, we said in order to decrease stress, you want to take a long breath out, shorter breath in. So maybe breathing in your nose for a count of 4, breathing out your mouth for a count of 7 or 8. Lavender essential oil or even lavender petals have been found to reduce anxiety. And even if you get an inexpensive lavender essential oil and rubbing it on your hands or using it in a diffuser at night or any time can be effective. Yes.
That says pre-bedtime routine.
Yes.
Better sleep leading to more resistance. Better sleep is not pre-bedtime.
Right. But a pre-bedtime routine equals better sleep, which then leads to more resilience. The equal sign is. So we're going to talk about what a pre-bedtime routine is. Though some of these things help with a pre-bedtime routine, which equals better sleep. And better sleep leads to more resilience. But we're about to talk about sleep. Yes?
Has anybody ever done an in-depth study between people who work in offices and people who work outside, and the difference between the stress and anxiety that these people would
People working outside and people working in offices. I can't say that I've run across that study yet, but I'm sure it exists. But I could look for it. It might be interesting, the people working outside, whether or not they find their job stressful. But I could see the influence of the fresh air and the nature helping to calm that person down. Yes? Oh, that's true. If it's terrible weather and snow and cold, that's... I wish I was inside in that office job. True. I'm assuming you mean like when people are working not in terrible circumstances outside. Is that right? Yes. No. I said I'm assuming you mean when people are not working in a storm or a terrible. Thank you.
even people working.
Is this
outside,
lavender?
if the weather's
Yes.
bad.
Oh, nice. Thank you, Crystal. I'm just going to kind of zen out here. But go ahead. Yes.
But people that are used to working outside, like construction workers, cowboys, and so on,
Yes.
They just dress accordingly and they carry on with their job every day.
Yes.
But I notice people that when they're in an office or they work too much with screens, phones, computers, and so on, these people here seem to be more stressed and anxiety-ridden than those people, even if the weather is bad.
Mm-hmm. Yeah. I can see that. So working outside or more of a maybe more physical job outside versus working in an office with a computer, telephones, deadlines, etc. What's more stressful? And you're saying the people who are working outside tend to have less stress. It's interesting because when you're working using your body, and I'm not saying I've read the study, but I can imagine when you're working using your brain and your body and you've got that outside environment, even if it's not sunny and lovely, there is more physical movement and there's better air. And when you're in an office, it tends to be very intellectually or mentally taxing. It's all here. Then you're not moving very much. So I can see it being a more stressful environment unless you're absolutely loving what you're doing. And then for you, it's like, oh, I love this, then you're secreting a lot of those bliss hormones as well. Yes, go ahead, Terrence.
Will you be touching on resetting the circadian rhythm?
I will be when we talk. When we get into sleep a little more, because having, or let's say being in sync with your circadian rhythm is a key factor in having better sleep, but also even better mental health. So the circadian rhythm is like your body's physiological clock. And according to that clock, certain chemicals are secreted, and those chemicals help us to achieve certain things. But sometimes we're doing things that just throw that clock completely off. I think everyone has their food. Is that correct? I'm getting the look. So let's say a prayer. Shall we pray? Dear Lord, God, we're just so thankful for this wonderful food and the opportunity to discuss health. I'm just pray, God, that you'll bless the food. It'll be good for our bodies. And also, we're thankful for the hands that have prepared it. And we say these things in Jesus' holy name. Amen. Enjoy your food. I'm just going to take a sip of my green smoothie. Wow, we went through a lot in 1 hour. Talking too fast. How about that then? Exactly. What isn't in the green smoothie? Sorry, I try to a couple of different blue-green algae in smoothie. Oh no, I didn't send you the recipe. A few different blue-green algae, liquid chlorophyll, spinach, romaine lettuce, lots of blueberries, some frozen mangoes, and then tart cherry juice. No, it's gonna keep me energized so that I'll do a good job until 8 p.m. tonight. So some broken cell chlorella also. I don't. Oh, good thing there's none in there. Mm. I actually had never heard of Adam's peanut butter before coming to DC. Is it a?
It's the most pesticided food product that you can have. It's super crop, crop illegal, they pesticide it. So peanuts, less organic, are really.
Right. They also tend to have a mold on them, which over time causes a buildup of a toxin called aflatoxin, I think, which then can cause liver cancer. Even if they say organic, there's a certain amount that organic doesn't mean 100% organic.
Nadine,
Yeah.
I didn't see you eating last night, and you're eating not now either. How come? Are you going, when you go to bed? With a full
Definitely
stomach?
not eating when I go to bed. So I usually only eat 2 meals a day. And my second meal is normally around 4 p.m. Tonight I'm drinking a smoothie at 6 o'clock, so I'd like to have it finished by 6:30, so I don't eat past that time. So with a meal like yesterday's meal, that would be more like my lunch or something I'd have in the middle of the afternoon. But a smoothie, it's not as heavy as a meal. But yeah, that's why. So your dinner becomes my lunch.
So you're not fasting.
I actually do intermittent fasting every day. So it is, but to me, intermittent fasting, which we will touch on this week, is just more like the way, I don't know how everyone else grew up. I grew up with after dinner, get out of the kitchen, that's it, you don't eat again until tomorrow. And now it's called intermittent fasting. At that time, it was just like my mom's discipline, like you don't eat at night. So basically, we'd have dinner between 5 and 6 and then not eat again until the next morning. I'm not saying I followed that forever, because when I went to university, I ate until 2 a.m. or so and gained nearly 60 pounds, which I've lost. But now I'm back to, I don't eat at night.
I remember your book.
Mm-hmm. Oh, yeah, you read it, which is awesome.
Yeah.
FYI, I'm working on a second book. I can't promise a finish date at the moment, though. Different topic. It's a little more Christian. There you go. I finished my smoothie, which was in the Adams jar. And the toxin that we were mentioning, aflatoxin, is just that I think that's produced by the mold, which is commonly found on peanuts. So out of the nuts that I recommend for my patients, actually, I never recommend peanuts. I consider, and in our nutrition class, we were told that almonds are the king, so I recommend almonds, organic, and I usually recommend organic almond butter instead of peanut butter. There's a great Canadian brand, as people are promoting Canadian products, called Nuts to You. Nuts to You, organic nut butters, and they have a really nice organic almond butter. Did you have a question before we start? Yeah. Oh, I thought your hand was up. Eating. Okay. So when you see this word on the screen, don't take it as a directive or a command. Instead, it would be do not sleep during this presentation. We'll be talking more about sleep as the week goes on, but we wanted to look at everything that we're talking about this week is in the context of improving mental health. So we talked about exercise for improving mental health, resilience for improving mental health. And this was a study that was done. This is a little bit further away, 2013, called Resiliency as a Mediator of the Impact of Sleep on Child and Adolescent Behavior. And we're skipping right to the bottom line. In the light of the findings of the present research, it might be considered whether an effective resilience intervention should include components related to promoting sleep quality. For instance, the establishment of positive sleep associations or good sleep hygiene, or at the very least, on obviating sleep problems. So what is good sleep hygiene? We'll talk about that. But basically, this research was, their conclusion was, how about focusing on higher quality sleep as a tool to building up more resilience? And it was a study that was done on children and adolescents and child and adolescent behavior. But I believe it could apply to adults as well. However, that's not what it says in the study. That's what I'm saying. These results also suggest that sleep factors such as sleep hygiene and medical conditions which can interfere with attaining restful sleep, such as sleep apnea, should be controlled for in any study which attempts to delineate individual levels of resiliency. Sleep is a major factor in resiliency or resilience. I'm not sure why I put this guitar in here, but speaking of Bob Dylan, apparently, that's what I think of when I think of the guitar. But I think I was thinking of music and its effects on the brain. And I want to talk a little bit about sleep, the different things that we do to help us get to sleep. And before I explain this, what are the things that you do to help you sleep? Yes. Yes. Lavender? Did you? Oh, amazing. Awesome. So yesterday I went through some natural herbs and some natural flowers, etc., that help with different things, including helping to improve our mental health. And I mentioned that lavender is a natural anxiolytic, so an anti-anxiety compound that can help with sleep and help bring down anxiety. And you could actually diffuse it. For most of my patients, I recommend they diffuse it about 30 minutes before bedtime. So then when they're stepping into the room, the whole room is like a lovely puff of lavender. But then if the issue is sleep disruption, as opposed to a sleep onset problem. Then some diffusers you can change the amount of time you want it to be diffusing for. Some diffusers will diffuse for up to 6 hours. So I recommend that you let it diffuse for the entire 6 hours. So if you're going to bed at 10, it's going to be diffusing right until 4. And if you normally wake up at 2, hopefully just breathing in the lavender as you pass 2 a.m. will help with that hour or that time of sleep disruption. So I'm glad that you implemented that, woo woo, and it was effective. A little. Mm-hmm. Yes. Yeah, great. So lavender, very effective. Crystal, thank you for bringing some lavender. Yesterday I brought in some dried lilacs and even smelling those, so calming. You can smell them. And actually, speaking of lavender on the temples, because lavender is also an antispasmodic, meaning it helps to relax muscles. Well, not necessarily on temples, but if you have back pain, muscle pain, etc., you can use lavender, maybe with a little bit of a carrier oil. I like to use a little bit of an anti-inflammatory carrier oil as well, and rub those together and then place it maybe on your back or wherever that muscle is, like an organic extra virgin cold pressed castor oil, because that's an anti-inflammatory, and you combine that with an antispasmodic, and placing that on the back, it really relaxes your back. I've also used lavender for headaches. Actually, in one case, someone had a headache. I had lavender essential oil. I don't know if it was my therapeutic touch. I don't think so. But I timed it. I said in less than 60 seconds, your headache's going to go away. Was it the placebo effect of the expectation of it going away? But I rubbed the lavender in and her headache was gone. So lavender can be effective on headaches as well. I find lavender to be more effective than the peppermint for sleep. But I'm glad that you used it in the diffuser. Anything else anyone else here uses for sleep?
Yeah, I
Yes.
use like this playlist.
Now
it's like yeah, it's funny. It's like fitting. I didn't realize I've been doing it for a while, but it's like soft music that's Christian worship instrumental. It's only music, not words.
Oh, it's
And-
just like instrumental, no words for lyrics?
Correct.
Yeah.
And it's helped out because I usually would sleep with a fan, but since I've been here for about a couple months, I haven't bought a fan. And so it's just kind of just implemented something else, and it's been helping me sleep.
Awesome.
Yeah.
So the fan provides white noise. So some people find that white noise helps them to sleep. But our brain responds differently to music. That's why there's a guitar on this slide. So different types of music help to calm the brain. As I said, music with more dissonance helps to not calm the brain, but more of a fight or flight response. But for a lot of people, listening to music before bed is a nice way of relaxing and getting into a better state. So that could be part of your pre-bedtime routine. Dimming the lights, putting the lavender in the diffuser, putting on some nice soft music, and that's all part of your pre-bedtime routine. Practicing the breathing. When you practice the breathing, it actually brings down your blood pressure, and it also slows your heart rate. So you're getting more into a sleep-like state. Go ahead, Glenn.
So, I mean, it is totally appropriate, obviously, when we're talking about sleep, to de-stressing. But we're talking about, I mean, this mental health miracle, so far we're talking about de-stressing.
Yes.
But in fact, there's an argument for a certain amount of stimulation.
Yes.
I mean, that's obviously the music that excites people. They want to be excited by it. And also people who play sports or are engaged in physical activities, they like the activity. And in fact, if they get too de-stressed, they can't
perform properly.
Right.
Would you like to respond to that at all?
Sure. I mean, I think there's a place for that type of excitement in terms of stress. But I'm talking about stress as in chronic stress that has a poor effect on health, a negative effect on health. So we want to address that type of stress and de-stress. There's definitely a place for feeling excited and more energetic, etc. And when people are in the physical activity, sports, etc., they're still exercising. They have a secretion of BDNF and a secretion of the bliss hormones as they're exercising, and usually they're doing something that they like as well. So I'm talking about chronic negative stress. And of course, we're talking about things before bedtime. So you don't want to be in an ongoing extremely relaxed state all the time. There's definitely a place for having more energy and more vitality, definitely. But we want that energy and vitality to also be part of being in a joyous state, as opposed to a kind of nervous energy and vitality that's negative. Yeah. Go ahead.
That's I like J.S. Bach.
You like Bach?
And
Okay.
it's fast, it's melodious,
Yes.
it's just entertainment, and it gives me peace. You
Right.
know, special, of course, the singing about the Lord, you know.
Oh, amen. There's definitely something to be said for classical music.
Yeah.
I mean, I love Vivaldi, and parts of it are very fast and then slow, and it's like you're going on a wonderful adventure with the music as well. So certain types of music, relaxing music before bed, could be part of your pre-bedtime routine. And we want to encourage a high sleep quality, because high sleep quality has been associated with higher resilience. Higher resilience has been associated with better mental health. And that's kind of this is the correlation cascade, you could say. So what is a high sleep quality? It means that you have a shorter sleep onset, meaning a sleep onset is how much time does it take you to fall asleep? So between 0 to 20 minutes, let's say not 0, but up to 20 minutes, maybe 30 minutes is right on the border. And then is your sleep disrupted? So hopefully you're sleeping through the night. And then are you getting a certain amount, more deep sleep? And then when you wake up in the morning, how do you feel? Do you feel refreshed? So those are different stages of sleep and different parts of high sleep quality. So we're going to talk about how to get better sleep. So better sleep equals higher resilience. Higher resilience equals managing difficult, stressful situations better, which leads to better mental health outcomes. Certain types of music can help the brain to go into a rest and digest kind of mode before bed. Rest and digest is more of a parasympathetic nervous system state, also known as a relaxed state. So you want to be relaxed before bed. Right before bed is not the time to take out your phone or your computer and let's do those last minute things right before you sleep and final work things so that they're not hanging over your head tomorrow, unless you're going to be ruminating about them right before you sleep. But you don't want to do anything that's too active, especially not too intellectually or mentally active, and even things that are too physically active. So exercise right before bed tends to cause cortisol levels to go up, adrenaline levels to go up, and then it's difficult to sleep. So exercise, wonderful, better to exercise in the morning, and I'm going to explain why. So these are my sleep hygiene tips. And for each of the sleep hygiene tips, I might ask you why you think it's there, and this would be a good exercise in understanding why these things are effective. Tip number 1, sleep in a fully dark room. Can anybody guess why that's important? What's that? Right. And how does light affect Sleep. Okay. And why? Go ahead, Andrew. Melatonin, right? Yeah, either melatonin or serotonin. So, it's melatonin. So when you sleep in a fully dark room, basically there's an association between light, as you said, and sleep and the amount of melatonin that your brain's secreting. So melatonin is known as the drowsiness or the sleep hormone. Some people take melatonin supplements to help them to sleep, but our brain actually produces melatonin, secretes melatonin on its own in response to light. So there's like a negative response with melatonin and light. The more light, the less melatonin. The less light, the more melatonin. Yes, Thyra? Yes, exactly. So if you're sleeping, the way that that association works is basically the light hits the retina. So if there's a lot of light, even if your eyes are closed, light goes through your eyelids, hits the retina. The retina sends a signal to an area in the brain called the suprachiasmatic nucleus. That area, it's like the brain's pacemaker. That area then sends a signal to the pineal gland in the epithalamus. The pineal gland then secretes melatonin based on the amount of light hitting. So if there's not a lot of light hitting the retina, then the pineal gland will secrete a lot of melatonin. If you have a sleep mask on, which I actually recommend, then the light's not going to go through the eyelids, so little to no light hitting the retina, sending a signal to the suprachiasmatic nucleus. It's dark. This is like your brain's way of interpreting, is it light or day? Sending a message to the pineal gland, secrete a lot of melatonin, and that helps you to fall asleep. So sleeping in a fully dark room, as dark as possible, could then lead to optimal melatonin secretion, which leads to better sleep. So sleeping maybe with blackout blinds or removing all the tiny lights in your room if you still sleep with a clock radio, or some people plug in their phone, their computer, their wireless headphones, all kinds of things are plugged in so there are lights everywhere. Those lights are still going through your eyelids and sending that signal, and maybe blocking the exceptional amount, like the highest amount of melatonin that's being secreted. You could wear a mask. You could use blackout blinds. You want to sleep to the point where if you open your eyes, even peek over your mask, it's like pitch black. Yes?
What about natural light? So let's say you go to bed around 11,
Mm-hmm.
and you have a decent sleep, and then the morning light hits the blinds around 4 now, because it's
Mm-hmm.
here, right? So what about that natural light? Is it the same as the little light?
So most likely you would wake up earlier, like with the light coming through the window. I mean, some people like that. They want to start waking up when dawn is occurring, and they want to go to sleep when it's dark at night.
Never thought about it. Like, I usually wake up around the same time every day, 7:30,
Mhm.
7:30, but that morning, like our blinds are kind of like these, they're not
Mhm.
blackout blinds.
Yeah.
It just wake me.
Yeah.
But you're saying that that penetration goes through the eyes.
Yeah. Though there's less and less melatonin being secreted, like as we go into the earlier hours of the morning. The only thing with that is, I mean, maybe it's possible here, not sleeping with blinds that cover the light completely. Then, if it's more of a city setting, then the lights, like the city street lights, come in, car lights come in. But maybe you're in an area where it's pitch black at night and no lights coming in. Yes.
If you go earlier to bed,
Yes.
say 9 o'clock,
Mm-hmm.
3 hours before midnight,
Yes.
you get a better rest.
Yeah.
Isn't that the case?
Mm-hmm. Mm-hmm. Just to answer Henry's question before the noise, sleeping earlier. So basically, the first, as I mentioned yesterday, your body's cycling through different stages of sleep. You start with light sleep, stage 1. This is the stage where when people are falling asleep and they'll suddenly jump. Then from stage 1 to stage 2, and then into deep sleep, and then into REM. And you cycle this about 90 minutes back to stage sleep 1, 2, deep sleep REM, 1, 2, sleep, deep sleep REM. Earlier in the night, your body goes stage 1, stage 2, deep sleep, and then hovers in deep sleep for longer before going into REM. So let's say you go to bed at 9 or 10. So you're capturing the opportunity to get more deep sleep where your body's going to spend more time in deep sleep. Later in the night, your body goes through stage 1, stage 2, deep sleep, REM, and then hovers longer in REM. So if you're going to bed earlier, let's say you're totally asleep by 10, and then maybe you wake up at 6. But maybe not. Maybe you sleep less. But you'll be spending more of that time, even though you're still cycling and it's still 90 minutes, it's more what's the distribution of time within that 90 minutes, more time in deep sleep, which leads to feeling more refreshed in the morning. Deep sleep's also effective for healing as well, especially if you've had an injury of some kind and you're looking for restoration. So that's why going to bed earlier creates better sleep quality. Noise. It's interesting. That's a little bit different. Some people can sleep through anything. I don't know if it's only when you're like hitting that sleep stage 1 where you hear whatever it is. It's hard to say. Yes. Sorry, did somebody just make a comment? Right, so Thyra's saying, then turn off your notifications? Okay. Step number 2. Always go to sleep and wake up at the same time. So why would that be important? Ouch. That's an ouch for a lot of people. Okay, why is routine important?
Your body adjusts a bit to like your habits, and if habits can coincide with like your body, then I think the regularity is good for it. Otherwise, if you're here and there, it can't pin down an exact like I'm used to bed at this time and I'm used to getting up at this time.
Yeah, I'd heard one medical doctor, his clinical focus is sleep, saying that routine is, in his opinion, the key, let's say like the master key to health. Very difficult for most people. When he said routine, he was actually referring to intermittent fasting. So eating at the same time every day, stop eating at the same time every day. And he was referring to the sleep-wake cycle. So he's saying if you get these 2 things down, this is what he said, he felt like that was like the master key to overall health. Of course, there are several other things involved. Yes? It helps with the circadian rhythm. Exactly. Yeah. Always going to bed and waking up at the same time helps with the body's circadian rhythm, which is like the body's physiological clock. So the same way that maybe you always go to work and finish work at the same time, I don't know. But your body has a physiological clock, and based on that clock, which we'll actually see in another presentation, so come back tomorrow, based on that clock, certain chemicals are secreted at certain times. But let's say if you're going to sleep and waking up at a certain time, Monday and Wednesday, and then Tuesday and Thursday it's different, and then Friday and Saturday it's different, your body's getting a little bit confused, so it's not going to be in the rhythm of secreting these specific hormones and chemicals at the same time all the time. And a lot of those things like testosterone, which if you're in a good circadian rhythm is secreted more earlier in the morning. That's why you might have heard the expression for being productive at work. The expression is eat the frog. Might not be popular here. But that basically means do the really hard things, do the hardest things earlier in the morning. Eating a frog's hard. So that's the idea. But we have more, if you're in a good circadian rhythm, you have more testosterone earlier in the day. Testosterone helps with energy, that kind of ambition, go get it. And that's secreted earlier in the day. Cortisol levels are also controlled by our circadian rhythm. You want cortisol to go up earlier in the day, to go down at the end of the day, so then you sleep better as well. So when you're in a good routine, then the different chemicals that help you to achieve whatever you need to achieve will be secreted at the times that kind of match those events and things that you're doing during the day. However, some people have jobs where they're working at night. And then when they're working at night, their circadian rhythm adjusts, but it's a little bit thrown off. And they've actually done studies on night workers, nurses in particular, and breast cancer in this particular study. Maybe I can find it and put it in tomorrow's presentation. But in this particular study, they found that women who were working at night as nurses weren't achieving the levels of melatonin as people who worked during the day and then slept all night. And so they were a little bit melatonin deficient over a long period of time. And there's an association between melatonin deficiency and cancer. So melatonin is a natural cancer protective agent, let's say. And so even though they were probably trying to sleep during the day, I don't know if they had blackout blinds and, a mask, but their body naturally just wasn't secreting the level of melatonin that was being secreted by people who sleep at night. And so we can change things around. Our body tries to adjust to, okay, you're sleeping during the day, secreting melatonin just based on the rhythm of always going to sleep and waking up at the same time. But our body, I would say, has a natural human clock where certain hormones are secreted more at certain times during the night, during the day. And what makes it even harder is if you're a shift worker and your shifts shift. So 4 days, you're on for 4 days, and then you're off for 4 days of nights, and then you're back on to 4 days of days, and you're going back and forth, and your body really doesn't have time. And most people who are doing that are taking something to help them sleep, and then they're drinking coffee to help them wake up, and then they're eating at different times when their body feels like it's time to sleep, so they're not using those calories, and then that leads to a series of other issues: insomnia, obesity, sleep apnea, sometimes even mental health conditions. But, we can't always control everything in terms of our jobs. And so I'm not saying if that's your situation, I'm not saying quit your job. But you quit? Really? Okay.
I was going to say that was confirmation because it was a wild schedule she was on.
Really?
Swing morning, and then graveyard, swing morning. So praise God.
Oh, praise the Lord. Okay, amen. Yes, and not good for mental health as well. Not getting that sleep quality, sometimes using substances, mostly caffeine, sometimes just to keep you going, and then using something else. Okay, I have to calm down and go to sleep now, even though it's noon. And yeah, so I have had patients like that, and we've worked with different supplements to help put them in a rhythm so their body thinks it's nighttime even though it's daytime. But praise the Lord, I'm glad that you're happy with that decision. So we're on number 2 of 10, but we've got a lot of time, so that's good. which was always go to bed, always wake up at the same time. So you're working in sync with your body's natural rhythm, which is called your circadian rhythm or your body's physiological clock. Number 3, do not drink liquids within 4 hours of bedtime. This is more just a logical deduction sort of thing. Go ahead.
Well, I generally take a small cup of water before bedtime, and I've been doing it for years. It
Okay.
doesn't seem to bother me, and very seldom do I have to wake up at night.
Really? Okay. Rebuttal for what I'm about to say. This is the pre-rebuttal rebuttal. Very seldom you have to wake up at night to go to the bathroom.
At times, but not
Yes.
regular.
At times, is that like more than once a month?
Yeah.
Okay. We'll just leave it at that. But yes, go ahead. Oh, not like his wife. Yes.
I'm up 5 times a night sometimes, but my brain keeps working and
Okay.
I can't seem to shut it off. And I don't drink caffeine or alcohol or any of those.
Mm-hmm. And when you get up, you said 5 times a night. When you're waking up, are you waking up to use the bathroom any of those times? Yes. Okay. So the main idea, which has just already been discussed here with do not drink liquids within 4 hours of bedtime, is so that you don't have to wake up to use the bathroom in the middle of the night. And if it's once a while, not terrible. If it's once a week, not terrible. But why not try to get to the point where it never happens and it's once a year, maybe. But what happens when you wake up in the middle of the night? So people think they wake up and then they go right back to sleep, and it's not really disrupting their sleep. Obviously, if it happens several times, it's disrupting your sleep, and then you're tired in the morning. But most people think, I just go to the bathroom, I go back to sleep, it's no big deal. So they don't mind drinking water before bed. But some people actually wake up, they go to the bathroom, they have the water there by the bedside table. So I tell all of my patients, do not put water by the bedside table. Don't even have water in the bedroom. Because I feel like they're just via some kind of invisible osmosis, they're bringing the water in. But they wake up, go to the bathroom, and then on their way back to bed, take another sip of water, and then go back to bed. Then they have to wake up to go to the bathroom, and before they go back, another sip of water, which is basically guaranteeing that within a certain period of time, you're probably going to have to go to the bathroom. So what happens when you're actually waking up to use the bathroom? How does it affect sleep? Sorry, did you have a comment? Mm-hmm. Mm-hmm.
Sometimes I do,
Mm-hmm.
just to sleep.
Yeah, yeah. So there are a few, and so that recommendation's within 4 hours before bed. So if you're going to bed at 10, let's say 10:30, that would mean that you stop drinking water around 6:30. Or if you're going to bed at 11, then you stop drinking water around 7. And there are a few things that cause dry mouth. Sometimes it's a side effect of medication. It's a side effect of a lot of medications. Sometimes it's anxiety, which we've been talking about as a mental health condition, which causes dry mouth. But sometimes it's just from not hydrating enough during the day. So people aren't drinking enough water during the day, and then they're thirsty and their mouth is dry at night. So it's around 6:30, 7 o'clock, 8 o'clock, then they're drinking water. And then they have to wake up to go to the bathroom, usually within 5 hours or so of having that water. So if you're drinking water at 9 o'clock, then maybe around 1 o'clock, 2 o'clock in the morning, your bladder is giving you a little nudge, let's say. But what happens? So instead of drinking liquids within 4 hours of bedtime, then the recommendation would be drink water as soon as you wake up, and then drink your water throughout the day so that in the evening you're not thirsty and your mouth isn't dry. And when you're making that switch, you might find your mouth is still dry in the evening, but eventually, unless it's because of medications or because of certain conditions where dry mouth is part of that condition, then you'll find that your body's adjusted. You're drinking water throughout the day. You stop around 6 or 7, and then you're okay throughout the night. And then as soon as you wake up, you drink water, you start rehydrating at that time. But what happens when you do drink the water and then you do wake up and you have to go to the bathroom and you think it's just once, no big deal, and then you go back to sleep, which is a common cause of sleep disruption. As I said, your body is going through those different stages of sleep. Stage 1, stage 2, deep sleep, REM. But then you wake up and you have to go to the bathroom. And then when you go back to bed, you don't drop immediately down into deep sleep or REM. Your body starts again at stage number 1. You're back to stage 1, stage 2, deep sleep, REM. A little bit later on, I have to go to the bathroom again, because on my way back from going to the bathroom, I drank some more water, and now I have to go again, and your body goes and starts back. Do you have to go to the bathroom? It's
with someone, then you guys are tagged.
Actually, this was what one of my patients was saying. But your body goes back into stage 1. So, and then at some point in the night, I said that your body is hovering and spending less time in deep sleep and more time in REM. And so you might miss that window of you're up and going back to stage 1 so much that now your body has shifted out of where it's spending more time in deep sleep, and now it's spending more time in REM, and you've lost out on the opportunity for some deep sleep. It's interesting with couples, because I did have a patient who was saying her issue, dogs do this as well. They disrupt sleep. The dog's moving, and then you wake up and think, I have to go to the bathroom. Or the dog has to go to the bathroom. Then you wake up so the dog can go pee, and then you think, well, while I'm up, maybe I'll check as well. And then you go to the bathroom. Or you have a partner who is drinking water maybe before bed or in the evening, and then they keep waking up to go to the bathroom. And that hits when you're in stage 1, and that wakes you up as well. So all kinds of things causing sleep disturbances. But the main idea is you want to be able to sleep through the night with a non-disrupted sleep and nothing disturbing you. So eliminating, addressing, and kind of pinpointing what are the factors that disturb my sleep that are modifiable or changeable. Okay, the dog's disturbing my sleep. Am I prepared to put the dog out of the bedroom? Hopefully people would be like, yes. Or at least not in the bed. I wake up to use the bathroom in the middle of the night. Am I willing not to drink liquids within 4 hours of bedtime? It's noisy in my room, so I'm sleeping with earplugs or addressing the noise, etc. So you want to eliminate any of these factors that are identifiable and easy to eliminate so you can sleep straight through the night. That's the goal. Yes? Okay.
Just turn them down.
There you go. You take them off. Take your hearing aids off at night, and it's a quiet sleep. And some people will do something similar. They're wearing earplugs at night, and then it's a quiet sleep, which I also recommend to patients who have difficulty sleeping with earplugs, sleeping with a mask. Other things that can help with sleep, we'll talk about them at the end, but they have done studies on weighted blankets and sleeping with a weighted blanket, just feeling that heaviness on you as you're sleeping. And that's been helpful in studies for better sleep. So we'll talk about things that help with sleep when we get to number 10, unless I just pepper them through as we go. But that is sleep hygiene tip number 3. Number 4, sleep in a clean room. Turn the thermostat slightly down before bed. Why would this be part of sleep hygiene or something that might help you sleep better? Okay, I haven't seen, you're like, clean room. Oh, you're thinking the cool thing, the cooler room. What was that? Okay, that's not really there. Clean room, turn down the thermostat. But you could open the window, which is a totally separate thing. But yes, getting more oxygen in your bedroom while you're sleeping, that can be helpful. Why would the room need to be clean? Or why do they recommend that your room's clean? Okay, I hadn't thought that.
I thought that right away.
Because of the danger of falling over something when you haven't done number 3. Right. Yes, definitely. And it's totally dark because you are doing number 1. So, right? And then click spilling the water. So you said something about stress. So sleeping in a clean room, the idea is like messy room, messy mind. So all the different things that you're seeing in your room, maybe that pile of clothes that I should be folding, but I'm not because I'm too tired, and all those papers that I wanted to take care of, but they're just sitting there, and your mind's thinking of all these things before you go to bed. So you want your room to be clean. For some people, it doesn't matter, but I think we're never quite fully aware of all the things that our minds caught, the ideas that our mind is thinking of right before bed. So you want to eliminate a lot of those things. Turn the thermostat slightly down before bed. People tend to sleep better in a cooler room. Melatonin actually naturally cools your body down, so your body temperature goes down. And if you can match that temperature in the room, apparently you're supposed to sleep better. I like sleeping in a warmer room, but according to studies, you sleep better in a cooler room. As a matter of fact, there's a certain temperature that's encouraged to sleep in Celsius. Can anybody guess what that is? Okay, I was going to say it's colder than you think, but no, it's not quite that cold. But all of my brrr is just like gone now. 18 degrees Celsius. So 18 Celsius is what is recommended for better sleep. Number 5, exercise regularly, but not too soon before bed. Janie, did you have a comment? Oh, I didn't say not an open window. It's not here though, but there was a comment. Yeah, dirty air, a lot of noise. Yeah, but if you're somewhere like this, in Lillooet with a big smile, then yes, an open window with wonderful oxygen coming in and better respiration, fresh air, definitely. Exercise regularly, but don't exercise too soon before bed. I already commented on that. When you're exercising, especially if it's a little more rigorous exercise, then your body is secreting cortisol, adrenaline, and cortisol is an alertness hormone, so that makes it hard to fall asleep. They've actually done a study, the Appalachian University sleep study, on the best time to exercise in relation to sleep, and then the type of exercise. I've always heard this. I didn't know that it was like an actual study that was done, but can you guess what this study's conclusion was in terms of the best time to exercise? Okay, within an hour of waking up. So it was first thing in the morning. And what type of exercise? Okay, exercising beyond your fingers. It was cardiovascular exercise, but it wasn't ongoing like cardio, like the elliptical, walking, etc. It was calisthenics. So easy exercises like squats or the plank or lunges or jumping jacks. And in this study, they only did like 5 to 15 minutes of these exercises in the morning on waking, and that was it. And what they found was they slept much better at night. So what you're doing first thing in the morning, and we're going to talk about this, what you do at night, those two things help to regulate your sleep. And I'll tell you the reason why. I was going to ask you why you think that made a difference, but, well, sure, I can ask. Can you guess why that made a difference? Maybe 15 minutes of calisthenics first thing in the morning, and then they're sleeping better at night. Why would it affect their sleep that same night? Go ahead. Yeah, exactly. It helped to set the circadian rhythm, but particularly the rhythm of cortisol throughout the day. So they're exercising early, their cortisol. So cortisol works on a 4-point scale. It goes up, down, down. And it set cortisol on that 4 points. So first thing in the morning, their cortisol went up. They're becoming more alert, more energetic. Slight dip, and then it went up again later in the afternoon, and then it started plummeting at night. So they're not feeling alert or energetic at night before bedtime, and then they slept better. So it's kind of like a whole domino, and the exercising first thing in the morning sets the dominoes off. Yes, go ahead, Glenn. Squats, lunges, planks, and jumping jacks.
So that model you just gave of the movement, the amount of cortisol, that's supposed to be universal?
Generally, yeah. I mean, optimally, that's what's happening with our cortisol levels.
Because I have also heard recently that there's some research that indicates short periods of exercise throughout the day are really good for you. And even you digest your food better if you do 3, 5, 10 minutes of exercise before or after a meal.
Right.
It actually helps. So there's all kinds of research that kind of goes in the directions of all this stuff. I was
Yeah.
wondering if maybe the studies of those people, are they developers? Are they carpenters? What are they doing? Because
Right.
maybe it's not universal. I'm not trying to refute you or anything.
Yep.
I'm just saying that there's a lot of research that turns out well. I mean, even if it's all done with college students, it's a bizarre group.
The exercise throughout the day, particularly in terms of digestion, which is something we encourage at the retreats that I work at, it's called a digestive walk, and that's done within 15 minutes of eating. And it does help with digestion, but it also helps, as we said yesterday, with burning up the sugar. So it helps to kind of balance and bring down blood sugar levels. In some ways. I mean, unless you're eating and your sugar level's high and you're feeling really energetic before bed. But that's like that's a digestive walk. That's more walking. But this was a different type of exercise that targeted cortisol in particular. So, and I actually have an example from someone in my own life who's an MD. And I hope she wouldn't mind if I told this story, but she and her daughters were all diagnosed with prediabetes. Her daughters bake a lot, and everybody eats the lovely things that the daughters bake, including the mom. She didn't want to go on any medications to bring her blood sugar levels down, and had already decided, like, they're going to find a way of bringing blood sugar down. So they decided they're going to do a digestive walk after every meal. And that's all they did. They would eat, wait about 15 minutes, go for a walk. It wasn't rigorous. It wasn't even a brisk walk. They were walking consistently for about maybe a little bit longer than a regular digestive walk, maybe 20 minutes. And that's what they did after their meals. And then they checked again. They did it for at least 2 months. And their blood sugar levels had come down. So they were helping to digest their food, but also burn up the sugars. They also cut down on the baked goods. So it was a combination of the exercise and the food. But yeah. I don't know. I didn't ask. She was targeting blood sugar. Did somebody else have a question or a comment? No? Okay. So exercise regularly, but not too soon before bed. Number 6, the bedroom should only be used for sleeping and intimacy. So why would that be a sleep hygiene hack, let's say?
So you don't develop habits of staying awake, like reading, for instance. That's a place where you do your reading on your bed, and you're liable to associate that with staying awake and reading rather than going to sleep.
Right. So your brain is making certain associations. So if your bedroom is also your office, let's say, that's the place, and it's also your gym. I've seen people, like friends, people I know, they have a treadmill in their bedroom. They've got their computer set up in their bedroom with their screen, and they do all of they work from home, they do their virtuals, everything in their bedroom, then they hop on the treadmill, and then they have difficulty sleeping. So your brain gets confused. It's associating the bedroom with work or the bedroom with exercise, and now suddenly you're going to sleep, and your brain's thinking, but aren't we getting ramped up and ready to do work? Or isn't it time to exercise? So you want the association of sleep, basically, to be associated with the bedroom, so that when you go in the bedroom, your brain automatically knows it's time to sleep, and this is the place where we sleep. Number 7, no electronics or blue lights within an hour before bed.
TV?
It could include TV, though some people turn TV on to help them sleep, but that's more of a habit. But it still could be affecting your sleep. Not going on the computer, not using your cell phone to scroll in bed before sleep. Any idea why? Aside from, okay, you get caught up in the TikTok video, and before you know it, an hour has gone by because you've been laughing and watching this thing. But there's another reason. Yes. Okay. So it's the effects of the light on the brain, and they're discovering more and more about this as we get further and further into the age of technology. But the initial thought was that the blue light is similar to sunshine, and you're looking at the blue light, and the light's hitting the retina, as I said, the same way that light does, and the retina is then sending that signal to that area in the brain, the suprachiasmatic nucleus, basically sending the signal that, oh, it's suddenly daytime. And so your pineal gland is going to secrete less melatonin. So the blue light interferes with melatonin secretion. And people use their phones to help them fall asleep. Some people, they take their phones in bed, they're scrolling before bed to help them relax, not realizing that just looking at the phone, they might feel relaxed, but it's elongating sleep onset. So they're on the phone for longer than they would expect because they're not getting drowsy, and then finally they get drowsy and fall asleep. Yes?
I do occasionally watch TV before I go to bed. Oh,
Mm-hmm.
if my team wins, I sleep well.
Really? So you're in a relaxed and joyous state before bed.
If the other team wins,
You don't sleep well. Right? You're in a stressed state before bed. So definitely our state of mind can make a big difference as well. Number 8, avoid caffeine, avoid alcohol, avoid nicotine. These all interfere with sleep. I'll start with caffeine. And it's interesting because they're now concluding that caffeine stays, or the half-life of caffeine, that is, how long does caffeine stay in your system, is much longer than most people think, or longer than was thought before. So let's say up to 10 hours, 11 hours. So if you're having your second cup of coffee at 2 p.m., and then you are someone who has sleep difficulties, hard to fall asleep, it's probably because there's a remnant of that caffeine still in your system, even though you think, oh, I had that coffee at 2 o'clock. It shouldn't be affecting me, but most likely it is. Not that I'm encouraging people to drink caffeine earlier. As it says on this slide, avoid caffeine. Alcohol, a lot of people, or not everyone, but you might have heard of the idea of having a nightcap. I'm just going to have a nightcap to help me relax and fall asleep. So alcohol does help with sleep onset, meaning it helps you to fall asleep, but it leads to disrupted and restless sleep. So you fall asleep, but then you don't have a good sleep. And then nicotine also interfering with sleep. Alcohol suppresses REM sleep. REM sleep is associated with memory consolidation, associated with emotional well-being, and alcohol also increases snoring. And snoring, I mean, you can wake yourself up. You could stop breathing when you're snoring, which is sleep apnea. You can disturb your partner. So eliminating these things. Your partner could leave. I mean, for some people, it's separate rooms, especially if that person is drinking alcohol. The partner already knows it's going to be rack you with snoring, so different room. When they hit sleep stage number 1, where it's light sleep, and you hear your partner. So avoiding caffeine, avoiding alcohol, avoiding nicotine, avoiding drinking right before bed, avoiding sleeping with your pet in the bed, or maybe even your pet in the bedroom. We want to pinpoint the different things we can avoid so that we'll have better sleep. Go ahead, Glenn.
You don't mention it, but marijuana is legal now, and lots of people like to smoke. And I'm not saying I'm one of them, because I'm not. Just to let that be clear. But you didn't mention that one. Some people think it helps them to sleep. It lowers their blood sugar level, apparently, or does certain things to them.
Mm-hmm. I think people, I actually can't comment very much on marijuana or CBD oil or even THC. And I'll leave that there. Number 9, get outside for 20 or 30 minutes in the morning. It helps you to sleep at night. What do you think's happening there? Getting outside for 30 minutes in the morning, helping you to sleep at night. Okay, partially. Oh, the circadian rhythm again. Exactly. So getting outside for 30 minutes in the morning. And what they found with that prime time in the morning, it's more first light. So first light in the morning. So when the sun is rising, which is called first light. And I don't know what time the sun's coming up now here, but it's early, right? And I'm like waking up at that time like, no, go back. I've got my sleep mask on. So when you get outside at that time, the recommendation is, this is from Dr. Andrew Huberman, who works at Stanford University, and he has a podcast called The Huberman Lab, and his main focus is studies on sleep and stress. So looking at that first light, and for at least 30 minutes, and it won't work if you're looking through a window or you're looking through your car windshield. You actually physically have to be outside. That's going to set the circadian rhythm, meaning the rhythm and cycle for the entire rest of the day. And then cortisol is going to go down and you will sleep better at night. Yes? I think you have to take them off. Yeah, good question. Yeah. So no glass at all, whether it's the glass of a window, a windshield, or even your own glasses. I think it has to be hitting the retina directly without anything going through anything. Yeah. Your eyes do have to be open. Yeah. So you're looking towards the sun at sunrise. And then finally, number 10, no napping. 30 minutes if it's absolutely needed, because for most people, napping during the day makes it hard to fall asleep at night, and then their bedtime tends to be later and later. Establish a de-stressing and calming pre-bedtime routine. So now we're coming back to that slide that we had before of the brain. A pre-bedtime routine. What are some of the things that help with sleep before we move on to nutrition? We mentioned some of them yesterday. So lavender oil, helping with sleep, calm music before bed, helping with sleep, doing breathing exercises, helping with sleep, just being outside in the fresh air at night, looking at the stars, and breathing that wonderful night air, unless you are living somewhere like Toronto and you live in the city and the night air is full of car pollution. So that's a little bit different. Helping with sleep, what we do in the morning and what we're doing at night, those 2 times of the day are the biggest for helping with sleep. There are some essential oils. People have found that peppermint essential oil is helpful for sleep. Rose essential oil is very, very calming for the nervous system. So it's a little more expensive than lavender, but rose essential oil has been very helpful for sleep in studies. Hydrotherapy, helping with sleep as well. But when I'm talking about hydrotherapy for sleep, this is more like taking a hot bath, and you might take some rose essential oil and put that in the bath. And after that, you're like ready for bedtime. Getting a massage right before bed, that would be wonderful to help with sleep as well. And then there are a number of supplements that a lot of naturopathic doctors do use that help with sleep. And I'm not recommending any of them since none of you are my patients right now at this immediate moment. But supplemental melatonin. So we're trying to do as many things as possible so that your brain, your pineal gland will secrete as much melatonin naturally as possible. For some people, they use melatonin that they'll buy as a supplement in the health food store to help them sleep as well. I'll just finish the supplements. 5-HTP can help as well. That's more for people who have anxiety. L-theanine is really helpful as well. But I really like to go back to those flowers, something like the lavender. Passion flower is very helpful as an anxiolytic. It can help with sleep. For some people, they just use it during the day if anxiety is high. So I like passion flower tea. And then there's an herb called ashwagandha. Ashwagandha helps to kind of decrease cortisol levels, decrease sleep, decrease stress. So for some people, they're using ashwagandha during the day. It's called an adaptogen. But for some people, when they use it during the day, they get very, very relaxed and maybe a little sleepy. So don't drive after taking it. And for some people, it's better to use that in the evening to help calm down as you're getting ready for bed. So all of these things. The one thing that I've mentioned, but it's not on the slide, is, as I said, changing the lighting, because you want your brain to start thinking, stop thinking it's daytime, start thinking it's nighttime. This is also according to Dr. Andrew Huberman. So these overhead lights where you're looking up and the light is coming down, that's more similar to a day sun kind of light. Lights with short lamps where it's more of a peripheral dim light helps to set the brain into more of a parasympathetic tone. You're starting to get that melatonin ramping up. So you want to dim the lights, put on lamps, and not lamps that are overhead and really bright, dim lamps that are shorter, let's say. And that could be part of your pre-bedtime routine, which is number 10. And there are a few other things that are in my sleep presentation. I think we've covered a lot here, but we have a little more to say, which we'll talk about tomorrow. Go ahead, Glenn.
I have seen that there is some research that suggests that if people supplement with melatonin, it reduces the amount of melatonin your body naturally produces.
Correct. Because melatonin is working on a feedback loop. However, then after you stop the supplementation with melatonin, then your body is going to catch up on that feedback loop. And yes, definitely. Hopefully you won't need to keep using the melatonin because you're identifying the things that are making it difficult for you to sleep. I don't really recommend it for younger kids. And for melatonin, not for everyone, rarely, but sometimes people have very vivid dreams as well. Not like nightmares, but more like lucid dreaming, where it feels like this dream is real. And so instead, I would look with a child, like, why are they having a hard time sleeping?
No, I know where Frankenstein comes from, I like it.
Oh, really? Your dreams are that vivid? Really? Yeah. I had one patient, maybe the youngest patient I had ever used melatonin in, and he was maybe 18. A lot of anxiety and I think just ruminating, etc. So during our follow-up, I said, is the melatonin working? He said, my sleeps are amazing, but I'm having these dreams. And I was like, oh, okay, well, maybe we'll stop. He's like, no, they're very good. So he was really enjoying these dreams because it was like a wild, wonderful nighttime experience. And so he was liking it. But for some people, I guess the dreams aren't as enjoyable an experience, let's say. Any other comments before we move on to nutrition? All right. So nutrition and things that we can do to help improve our mental health in terms of nutrition and eating. And most of the things we're talking about today are just like a quick little overview, though we spent more time on sleep, that most likely I will dig into a little further as the week goes on. But we moved from discussing the actual classifications of mental health and introducing resilience yesterday to talking more about resilience and introducing ways where we can become more resilient today. And then we'll move deeper and deeper into these topics as the week goes on until Friday evening between 5 and 8 p.m. So, a breakup with sugar. I remember a song, or have heard of it, called Breaking Up is Hard to Do. And when it comes to sugar, sugar can actually be part of the dopamine addiction cycle. So basically you get some sugar, you get a burst of dopamine, wow, that was amazing, and then you want more sugar. And the way that cycle works, whether it's sugar or it's drugs or it could be gambling, whatever it is where there's a sudden surge of dopamine, there's an area in our brain, I believe it's in the prefrontal cortex, which is like a dopaminergic accountant, you can call it that. When there's a sudden burst of dopamine, then there's an analysis done and a memory is laid down in the hippocampus. Like that must be important because there was a sudden surge of dopamine. That memory is laid down and that is part of the cue, or it pushes you to do that thing again. And a sudden burst of sugar, a memory is laid down, wow, that was amazing, and then you get the cue to have sugar again. Oh, here's another occasion to have sugar. So when people talk about a sugar addiction, it might seem odd to use the word addiction with sugar, but it can be an addiction. And then even just the thought, like when people say I'm a chocoholic or I'm a chocolate addict, even the thought of that thing could cause the secretion of dopamine. Oh, I'm just thinking of how delicious that chocolate fudge sundae is going to be. A little bit of dopamine. So we can use it to our advantage and instead think, I'm just thinking of how amazing that quinoa bowl with the tofu is going to be. Wow. And then there's a burst of dopamine. And that's going to help to encourage you to want more and more of that. When it comes to sugar, it's hard, but breaking up with external sugars, so extra sugar that is not in a natural packaged form, such as fruit, though I do encourage more berries than really sugary fruits, especially if you are diabetic, pre-diabetic, or maybe even a family history of diabetes. But the first step towards better mental health, I would say it's time to give Pop the goodbye squeeze. So an easy thing to eliminate from our diets, and maybe there's nobody here who drinks it, but it would be Pop. the other interesting thing about the sugar cycle is you eat something with sugar, your energy goes up, you feel amazing for a little while. And then after that, your energy goes down and you don't feel amazing, and then your mood is low. And then you want to have more sugar and your mood goes up. So you're creating a dysregulation of sugar and mood throughout the day. Yes.
How about honey?
I mean, honey still, your body still interprets it as sugar, but at least there are some healing properties in the honey. Antibacterial, antiviral, so good sugars, and a better option than white sugar, I would say, or maple syrup. At least there are some health benefits of maple syrup as well. And usually people aren't taking large dollops of honey every day. They might be using a little bit, maybe in their herbal teas, hopefully, and that's kind of it. So this is sugar like drinking pop, eating ice cream, fudgesicles, fudge in general, bakery, pastries, etc., all really sugary items, hot chocolate, adding a ton of sugar in your tea, coffee, etc. So eliminating those sugars that we are all familiar with, candy, excessive candy, and also not good for your teeth. Yes, go ahead.
There's a doctor on YouTube that comes on this, and it's, for some reason in the algorithm gives me his ads quite regularly, named Dr. Gundy.
Yes, Dr. Stephen Gundry.
Gundry, right.
Yeah.
And
he actually went to Loma Linda University, which is Seventh-day Adventist University.
Is that right? Well,
yep.
he suggests that, and I like having a smoothie every morning as part of my, he says it's poison. You should never eat smoothie. You should never eat fruit. Basically he's opposed to fruit.
Yes.
He says the fruit's got to go.
Yeah. I got the ad too from the podcast.
Probably because of other stuff we're watching.
Yes.
They think we're interested in health, and so they think we should listen to him.
Yeah. I think it depends what's in your smoothie. So you want to avoid a sudden glucose escalation first thing in the morning. And then your pancreas is going to secrete a lot of insulin. So avoiding glucose spikes. When you have a lot of sugar first thing in the morning, you're setting yourself up for this blood sugar dysregulation throughout the day. Sugar goes up, pancreas secretes insulin. Insulin causes sugar to be driven into the cells unless you have an insulin insensitivity. Then sugar comes down, and then you get a craving, sugar goes up. And so it's this roller coaster throughout the day, which is also a roller coaster of mood. You feel good, you feel low. You feel good, you feel down and irritated. So I think it depends on what you're putting in your smoothies. If you keep listening to that, so I got that as well, but then it turns into like an infomercial kind of thing, and in the end, one of his products, exactly. Yes. So in the smoothies, which I do recommend first thing in the morning, I recommend using more sour fruits, or fruits that aren't particularly sweet, like the berries, dark berries, blackberries, blueberries. Strawberries, organic is a little bit better. All those berries, whether purple, black, or red, are high in anthocyanins. They're high in antioxidants, and they don't necessarily cause blood sugar dysregulation the way using really sweet fruits first thing in the morning do. So I think that's probably where he's going with that whole thing, etc. So I do recommend the darker, more bitter fruits. Or if you're just having a bowl of fruits, you could have a berry bowl. You might have a green apple, like a Granny Smith green apple, very sour. It helps to regulate blood sugar as well. And on that bowl, you could even sprinkle a little bit of cinnamon, which helps to regulate blood sugar also. So you're avoiding that sugar spike early in the day. Moving on a little bit from nutrition, which we're going to talk about more. I think I have a mix of slides, but I wanted to talk just a bit about habits. Because when it comes to, let's say, sugar addiction or changing nutrition or getting more exercise, the basic idea is you are trying to establish a new habit. And part of establishing that habit, even the way that you think, even exercising. When you've established that habit, especially these good habits that we're talking about, then you're promoting more resilience. And so our resilience is, we're growing resilience as we're consistent in these changes and habits. So consistency, I would say, is one of the main things. As I mentioned, there's been lots of studies about neuroplasticity. The book that I was talking about, The Brain That Changes Itself, is by Dr. Norman Doidge. And part of changing the brain and rewiring is being consistent. So being consistent, being intentional, and focus. An individual's resilience is dictated by a combination of things. Yes, there's an element of genetics, personal history, environment, and situational context. So far, research has found that the genetic part is actually relatively small. So you can learn and build resilience. So it's not all genetics. That person was just naturally born to be stronger than everybody else. The genetics part is small. The way I think about it is that there are temperamental or personality characteristics that are genetically influenced, like risk-taking, or whether you're an introvert or extrovert, those are more genetically influenced. This is by Kerstine Keenan, a professor of psychiatric epidemiology at Harvard's T.H. Chan School of Public Health. But resilience isn't necessarily part of these genetic influences that he's talking about. And that's the gene chain there. Thought that would add to what I'm saying. Professor Keenan studies how genes shape our risk of post-traumatic stress disorder. We all know people that are just very even-tempered, she said. Some of that is simply how we're built physiologically, and yet it isn't true that some people are born more resilient than others, said Professor Keenan. That's because almost any trait can be a positive or a negative depending on the situation. So it's not true that some people are just naturally born more resilient than others. The bottom line, anyone can become more resilient. Amen? It's just a matter of consistency with some of these resilience habits. Resilience habits. Beyond resolutions. I say beyond resolutions here because a lot of people make a resolution, especially New Year's resolutions. I'm going to exercise more. I'm going to wake up first thing in the morning and I'm going to look at the sun. I'm going to go to bed at this specific time. And we want to go beyond these resolutions, or on your birthday, you do an analysis of how the year went and then you make a resolution. This year, I'm going to, and all the things I just said, exercise more, I'm going to lose weight, etc. When it comes to creating a resilience habit, we want to go beyond resolutions to actually being at the point of implementation and being consistent. Habits are built through learning and repetition, and that's, the brain really loves repetition. A person's thought to develop a habit in the course of pursuing goals, such as driving to a destination or satisfying a craving, that's not necessarily a good habit, by beginning to associate certain cues with behavioral responses that help to meet the goal. So we talked about some of those for sleep. You have a certain cue and then a behavioral response. Maybe you have your treadmill in your bedroom. The cue is it's time to exercise. The behavioral response is, well, hopefully you're not exercising. I'm not sure why that happens. But the behavioral response is your body gets riled up and you're not able to fall asleep right away. We have habits that we don't even think about. Turning at certain streets. Have you ever driven so many times to one place and then you're in that vicinity, but you're going somewhere else and you naturally turn down that street and you think, what am I doing? I'm not going there today. That association is already there. Stopping at a drive-through with a familiar sign. I'm not really that hungry, but ooh, maybe I should go through that drive-through. This is how advertisements work. Over time, thoughts of the behavior and ultimately the behavior itself are likely to be triggered by certain cues. So one of the things we can do when we're creating a new habit is use old cues to stick in a new habit. And this was something I first heard about by an MD. His name is Dr. Rangan Chatterjee, and he was on the BBC originally, and he now has a podcast. And as an MD, he also uses lifestyle changes to help his patients. So he noticed that basically patients weren't doing what he was asking them to do. And he was trying to figure out, how do I kind of push these patients to do these things that would be better for their health? And one of the things that he was encouraging was exercise. So he would tell a patient, okay, I want you to, for example, do walking for 30 minutes a day. And then the patient would come back and he'd say, how's the walking going? And the patient would say, I haven't been walking. And then he'd say, but why haven't you been walking? And they would say, I don't have time. I haven't created a habit for it yet. Most common excuse or response was, I don't have time. I've just found it's too hard to fit in 30 minutes of walking. So he said, okay, if that's the case, then we'll cut it down. We'll start with 15 minutes of walking per day. And the patient would say, okay, I'm pretty sure I can fit in 15 minutes of walking per day. Next checkup comes, how's the walking going? And they'd say, actually, I haven't been walking. And he'd say, but why not? And they'd say, I don't have time. Exact same answer. Not even 15 minutes. No, I'm so busy. I have the kids and work and blah, blah, blah. I'm trying to do it before I wake up, but I'm finding it's hard to wake up to implement the walking before work. So now I'm going to try to do it after work. He'd say, as an experiment, because he wanted to see, is it really time? So he told one patient in particular, 5 minutes. 5 minutes of walking per day. Do you think you could walk for 5 minutes? Anybody can do that for 5 minutes. Next appointment, how's the walking going? And you know the answer was, I haven't been doing it. And he said, don't tell me you don't have 5 minutes. And they'd say, I'm finding it so hard to even put 5 minutes of walking in. It's difficult to squeeze it in. So he thought it's not the time. It's just this question of how do you establish the new habit so it's easy for the patient to do that new thing. So he asked the patient to walk, this was a woman actually, walk him through their morning. And she said, well, I wake up, I drink coffee, so I'll put the coffee on, and then I sit down, then I read the paper, and then when the coffee's ready, I drink the coffee while I'm reading the paper, and then I go and I get ready, etc., etc. And he was very familiar with the idea of neuroassociation, so using a cue to associate with a behavior. And he said, okay, why don't we do this experiment? We want to find something that is a regular cue, something you do every day. What you just described to me, do you do that every day? You always wake up. You always put the coffee on. It always takes the same amount of time. Yes. Okay. Let's use your coffee time as the cue, and we're going to sneak in a new behavior. He called it a neuroassociative hook. So we're going to use the coffee as the hook, and we sneak the new behavior in. So basically, you wake up, you go downstairs, you put the coffee on. Now, when the coffee is on and brewing or getting ready, you've got about 10 minutes, 10 to 15 minutes. When you put the coffee on, that's your cue. I put the coffee on, I do squats, I do planks, I do my 10 to 15 minutes of calisthenics right there in the living room, lunges, and then using the idea of a reward. Not that I'm saying coffee should be a reward, but in this case, he was squeezing it in. Then you get the coffee. All right, I did it. So a little bit of dopamine's being secreted as she rewards herself, and they used that, putting the coffee on as the hook. I've said coffee many times. I don't actually encourage people to drink coffee, but that was the hook. And he found this with each of his patients. He said, okay, well, describe your daily routine to me. And he'd find something in the daily routine he could use as a hook, and then create a neuroassociation, and then create a little bit of a reward. So they're not trying to implement something as brand new. They're just sneaking it into an already pre-existing cue.
And the coffee tastes better.
The coffee tasted better maybe because it was a reward. Like, I did it, yes. So if you you can use that pattern yourself to put in whatever that new habit is. Think of your own routine. What could you use as a neuroassociative hook? Something that you're doing every day. Okay, I'm going to squeeze this in, which might be exercise, 15 to 20 minutes of exercise. And then how at the end of that can you reward yourself? And the reward would not be with food or sugar, right? And you're like, forget the whole thing now. The reward might even just be high-fiving yourself. Woohoo, I did it. Like something to identify and acknowledge that you just did that thing. You want dopamine to be secreted at the end, which is going to encourage you to do it again. Does that make sense? So that's how you're creating habits. And that's what Dr. Chatterjee did. And he found it was very effective for all of his patients. He just had to help them to find, what is your hook going to be? And then they would talk about it, they would implement it, and after that, it wasn't, how's the exercise going? I don't have time. It was, it's going. Like, it's easy. So we want habits to become easy, and we want to use the idea of a hook, so we have this association in our brain with that new habit and that old hook. Some of the things that also help with, some of the things that also help with establishing a new habit. Just asking yourself, is there something that I'm not addressing? So why do I have that question here? Because sometimes when it comes to success or establishing a new habit that you know is going to be good for you, sometimes people will do it for a short period of time, like losing weight. This happens quite a bit. And then they'll stop. And you'd have to ask yourself, sometimes people stop just when they're starting to succeed, like this habit of sabotage. Why are you not allowing yourself to succeed, or allowing yourself, you only allow yourself to feel good a little bit, like I'm doing really great. And then something in your brain goes, no, this isn't you. And then you drop it. So is there something that you're not addressing? Maybe this question of value or worthiness or deservingness. Those are all deeper questions. But is there a reason why you don't continue, or maybe why you self-sabotage? And that's a much deeper question, but something to ask. Really, habits are about, as I said, neuroassociation. We want to get to the point where they're automatic. Resilience can become automatic as well. So it just takes consistency. And if it's a new habit, especially something that you know is going to help with resilience, like exercise, then you want to find an easy way to put it in. For one of my patients, this was someone who has obesity, type 2 diabetes, high blood pressure, hip pain, etc. We just wanted to focus on exercise and making dietary changes. And so exercise, I was trying to find, is somewhat like Dr. Chatterjee. Can you do 20 minutes? Can you get a gym membership? So he got a gym membership, but wasn't using it. So at least he took that first step. But now he's paying for the gym membership and not using it. So that wasn't really working, but I was really excited that he bought the gym membership. So that was the first step, but ended up not using it at all. So I said, okay, walk me through your day. Tell me what you do. I wake up, I make breakfast, I get in the car, I drive to the office. I said, are you usually late going to the office? No, I'm usually early. Okay, perfect. Why don't we just do this little thing where you park? Where do you park when you get there? I park right in front of the doors. Okay, so your cue is going to be driving to the office, but then when you get there, you park at the very end of the parking lot, as far away as you can, because you're early. So he's always a very early person, and he didn't mind taking that extra 10 to 15 minutes to walk to the door. So that's an extra 10 to 15 minutes of exercise. So he actually did that. That was easy. Not saying the walking was easy. And then at the end of work, he knew when he gets out, he has to walk 10 to 15 minutes, this is a big parking lot, to get to his car. And so we kind of snuck in an extra 20 to 30 minutes of exercise, that was fairly easy. And he did that every day, as opposed to the gym membership and going to the gym and, wearing the shorts and the running shoes, etc. I can't remember if he changed his shoes when he did the walking, but that was easy. And that just became a really good habit. The idea is that your thinking and your success are in your hands. Focus on only a few things at a time. So we've talked about several things this evening as well as yesterday. But sometimes when you're trying to make habit changes, if it's just too many things, then it becomes like trying to juggle all these things in the air. And for anyone who's juggled, eventually you'll let one ball fall and then they all it's all willy-nilly from there. So instead, you can choose whatever you're going to target and then focus just on that one thing or those one or two things. After they've become a habit, and studies show that it takes 6 to 9 weeks for a habit, to become automatic, then you can move on. Okay, I've got exercise down. That's amazing. Okay, now I'm going to move on to changing sleep. But maybe I would change the sleep habits first, then you'll feel more energetic, and then you'll be able to exercise and implement exercise after that. Focus only on a few things at a time. A practice to help with resilience or help with de-stressing, meditation or meditative prayer. This might be something that you might consider doing at the end of the day, just sitting down. And you might have a Bible verse in mind. You might just sit and pray, meditate on how good God is or the wonderful things that have happened during the day. The goal is to practice a technique that will counter stress. So you're getting calmer as the day ends. Or maybe at the beginning of the day. If you've got a really tough day ahead, you could start like this. Also, in turn, this helps to lower blood pressure, lower heart rate, lower breathing rate, and lower the stress hormones. Things such as deep breathing exercises that we've already talked about, a meditative walk in the garden, a gratitude meditation or prayer, practicing those things. Maybe at the end of the day, maybe if your job is really tough at the beginning of the day, that meditative walk in the garden might be right before you begin work. That can be really helpful. One of the things that they find with resilience is part of becoming more resilient is just changing your perspective. Sorry, I know that slide's hard to read. Changing your perspective. Is it a 9 or is it a 6? Some people say 9, some people say 6. Is it both? Is the glass half empty or is the glass half full? So changing your perspective. So this is something we're going to talk more about in terms of mental health tomorrow, because reframing and viewing things differently is a key component to resilience and can make a big shift in mental health. So seeing the upside rather than the downside of a predicament, a habit that doesn't come readily all the time. So it might take a little more of a meditative time to look at that predicament and see the upside instead of the downside. I remember listening to he's more like a transformation coach who is Canadian, who recently died about 3 or 4 years ago, whose face I can see and I suddenly forget his name. Lived in Toronto. Bob Proctor, maybe? I think. Yes. So Bob Proctor would say, in terms of, so this isn't my habit, but I could implement it actually instead of just talking about it. But he would say he would write the predicament, whatever the difficulty is. He'd write it down on a piece of paper, sit at a table, and put it there, the problem. There's financial problem, I owe this much money, whatever it is. Put it there. And then he'd think about it, and then he would stand up and then go sit at a different chair. So he's sitting somewhere else and then look at the paper. Okay, financial problem, I owe money. Okay, Okay. And then he would sit, he would get up. So he's changing his physical position to try to see it from a different vantage point and see it from a different point of view. And he found that that always helped. Like he would suddenly get a different idea, like, oh, maybe I can do this. Oh, maybe it's not so bad. Maybe this will work. So that's the idea. You don't have to physically do that, but the idea is that you're seeing the upside or seeing this predicament differently rather than just focusing on the downside of that predicament. So turn the circumstance around so that you can see the positive aspect of it. Your friend goes on vacation and doesn't call you at all, for example. You could be happy since it probably means maybe your friend's having an awesome time. That is called reframing. So that's the first way that's suggested here. Reframe your predicament. Instead of thinking, I can't believe they went without me, we're not good friends at all, I feel so left out, you could think of it differently. I hope they're having an excellent time. Maybe they're feeling less restricted without me. There's always a different way of seeing it, and this tool or technique, which we'll talk about more as we go, is called reframing. And it's a tool that's used in counseling to help with stress. So different resilience practice and habit. There's Dora saying, oh boy, this is going to be good, I can tell. It's think of a positive outcome, not a negative outcome. And this is a psychotherapist, Malloy. You can even bring in some visualizations. For example, think of an upcoming situation. Visualize the positive qualities that you want to bring into it, or you visualize a good outcome from whatever it is that is coming up. Maybe it might be something like a job interview. And you visualize yourself acing the job interview and walking out feeling great. When you go into that job interview, you're going to go in with a different demeanor and also maybe a different attitude because you've already kind of programmed your brain for a good outcome. Does that make sense? Other things as we're wrapping up, different resilience practices. Cultivating positive thinking. This is Laura Malloy. She is the Successful Aging Program Director at the Harvard-affiliated Benson Henry Institute for Mind-Body Medicine. And I read in one of her articles where she says that they have people focus on 3 things that are going well, or as I'd said yesterday, 3 things that they're grateful for each day. 3 things that are going well in your life, or 3 things you're grateful for each day. And they do that to build up their resilience. 3 things that are going well, or 3 things you're grateful for each day. 3 things you're grateful for each day. You can combine that with your breathing exercises. So it's like you're breathing in gratitude, you're breathing out gratitude. And gratitude really helps to shift our mind. And I see that I have a whole bunch of slides left, and I thought that I was going to end up finishing early. But I don't think I'm actually going to get through them. And I think the next slide actually delves into quite a longer topic that I wouldn't be able to finish in 4 minutes. So it is about 4 minutes to 8, maybe 4 to 5 minutes to 8. So I think we'll end there. So we have some time for questions or comments. Does anyone have any questions or comments? So the way that we were going to end was talking about Emmy Werner's 32-year-long study, which I mentioned yesterday, which is in the slides for today. But I think we'll leave that for tomorrow because I basically delve into the study and I pick out her resilience hacks. Like the conclusion of her study was these things are things that we can apply to build more resilience and better mental health. So I'll leave with a cliffhanger there. So we'll talk about that study, the conclusions, and the tips based on Emmy Werner's study and her ongoing research tomorrow. Yes, go ahead.
So
Mhm.
sort of equating resilience with mental health.
Correct. Yeah. Resilience, building up our resilience to have a positive effect on mental health, or building our resilience to help with certain mental health conditions, such as depression and anxiety in particular. And that's why I wanted to present some of those studies that showed that resilience is a factor in helping with some of those mental health conditions, particularly depression and anxiety. And then I want to move to how do we become more resilient so that either it can help with those conditions or it can help us to avoid those mental health conditions. The habit thing, learning the tools, and then implementing the tools. So without talking about how to form a new habit, it's good to learn the tools, but it's also good to learn how do I implement the tools so it just becomes a habit. So exercise becomes a habit, or waking up, or at the same time and going to bed at the same time every night becomes a habit. So we will talk a little more about the neuroscience of how to change a habit, because often we know what to do, but we don't actually do it, or we don't find out how to do it in an easy way, and then it just becomes information instead of a transformative experience, which is the goal. I've heard the saying, knowledge is power, and I think it's actually knowledge and the implementation of the knowledge is power. If not, it's just information. And we want to go beyond that. Yes, go ahead.
You know, when we were talking about nutrition and sugar, I worked with a fellow that used to drink 48 cans of Coke.
48 cans of Coca-Cola per day.
And you know,
Wow.
he was one of the most positive.
Energetic, I bet.
He was one of
Yes.
the most positive, can-do guys I ever worked with. And he lived quite ill to quite an age.
Okay. Until what age?
What's that?
How old was he when he passed away?
Not too old. He lived to about 78, 79.
78. Okay. If you had said 97, I'd be like, oh, wow. But I'm not surprised that he had a lot of energy with 48 cans of Coca-Cola per day. That's a lot of sugar. So he was probably pretty energetic throughout the day.
I think it shows the difference in people as well.
Mm-hmm.
Some people could never, ever survive.
Right, right. It's also a lot of caffeine in the Coke. So that combination of caffeine and sugar leads to a lot of energy. But yeah, maybe some people, they would have died prior to the age of 78. You
My-
said 78, right? Yeah.
My question
Go
is,
ahead, Henry.
George, how was his weight? He was slim.
Yeah.
Wow.
Did he work a physical job though? Did he have a physical job? Was it an office job?
As he got older, though, he had to go on oxygen.
Oh, the rest of the story is coming out now. As he got older, he had to go on oxygen, and then he died at 78. And what were his teeth like? Yes. Yeah. Right. Mm-hmm. I don't think the Coke helped. Yeah. And then the teeth, often people actually do end up getting their teeth pulled and dentures. And most people think that's normal when you age, but it's possible to still have your teeth in good condition and be 80 or 90. And yeah, but sugar definitely is a factor there. Yes.
There are similar stories about people who drink and about
Yes.
people who smoke. I mean, there was a
Yes.
famous blues piano player who lived to be around 100 called U.B. Blake, and he smoked.
Yeah.
And somebody said, "What's your secret?" And he said, "Well, if I knowed I was going to live this long, I would have took better care of myself.
Right.
But also, I know people that, they're in their 80s and they've been drinking for a long time in an abusive way, self-abusive.
Yeah.
But there's people who are in their 40s, their liver packs it in. So it's
Right.
these are probably
There's-
genetic factors somewhere.
Exactly. There's definitely a genetic factor involved when it comes to longevity. But then there's also the question of your health span. So maybe at 80 years old, are you still agile with sharp mind and youthful, etc.? Or are you 80 or 90 years old but not in good health but still living because of the genetics of your forefathers, etc.? So we want that combination of longevity and health to go together. But there's definitely a genetic component when it comes to longevity, for sure. Yeah. Oh. All right, George. We'll have to wait to say happy birthday tomorrow. Yes? Yes. Oh, so George doesn't drink and doesn't smoke. Perhaps contributing factors to being 90 and still sharp.
Well,
I'm assuming he was the cowboy your mom wanted you to meet. Yes.
but my family had longevity in it. I had a couple uncles almost made 100. My dad died at 96 or 97.
Yeah.
So we've got longevity in the family.
Yeah. So that's a nice combination of the genetics plus the health, not smoking and drinking together. And you're still sharp and still a cowboy at 91 and eating the blueberries. We're going to get into the nutrition a little further, but yes, I definitely encourage wild blueberries.
He was a prospector.
A
That made his
prospector.
life.
Oh,
Prospecting.
he didn't work a day in his life, as we said. No, I didn't mean he didn't work like he was lazy. I meant because he loved it. Exactly. Exactly. Amen. Still doing it? Wow. All right. So the idea of retirement just not happening, which is another subject. But
We're
yeah.
going to be married 71 years tomorrow.
Wow. Actually, that is a factor in longevity and happiness, actually. Oh, okay. Well, I'll take back what I was about to say, which was they found that people, especially men, live longer if they're married, but if they're married in a good marriage and a happy marriage. So you're about to turn 91, living long, been married for 70 years. But the test is, do you look like each other?
Well, you see how it works. Karen was running her health food store,
Yes.
and I had a small construction company. I was out of town quite a bit.
Okay.
So we used to get the odd date on the weekend.
The weekend dates. Well, that's a nice combination of a little bit of space, a little bit of togetherness, a little bit of space. Maybe that's the key to,
Lots of money.
and lots of money. Well, I think we're going to move on to ending with a prayer now with that comment. So let's bow our heads and we're going to say a prayer now. Dear Lord, we're so thankful for this wonderful evening and late afternoon. We just pray and ask God that you be with every person here who was here and everyone listening. Lord, please help us to make changes that will help us to have more resilience, better mental health, and also better and longer longevity and a longer health span. We say these things in the holy name of Jesus Christ, our Lord and Savior. Amen. Have a good night, everyone. Thank you for coming.